Yay! We're here.
That's your transition?
What the fuck?
That's your level of excitement when greeting your esteemed viewer. Yay!
Yay! We're
guys!
here.
Whoa! I'm so excited to be. Jesus Christ! At least show like some glee and whimsy. God damn!
This is my version of glee and whimsy.
You need to work on that, man. That's embarrassing.
I've been a streamer longer than you've been. What have you been doing for the past 8 years?
You've been streaming for 8 years?
I started streaming my first year of med school. Stop laughing at me. All right, fuck it. I will do the introductions. I will be the one that's doing the talking now. Deadass, I'm going to mute you. All right, I'm muting her. All right, guys, what's up? Well, welcome to today's stream. We are going to be playing Doctordle again, except I'm not going to be doing shit. Basically, what I wanted to do was this idea that I got in the comments from the previous video, where what happens if a layperson tried to play Doctordle, but, you know, had the whole internet available to them, right? So WebMD, Google, whatever, because that really kind of reflects how people use the internet for medical information nowadays. And we were saying, what if we just grab some random people and try to see how well they do compared to, you know, a doctor trying to diagnose. Again, it's Doctordle, so it's not perfect, but I think it'll be a fun time. And victim number one over here was actually victim number one is me, because I am the victim today. What if we just grab some random people and are you watching? Are you watching the stream right now? What is going on? Why are you like this? Oh my god. Anyway, you want to introduce yourself?
Hi, I have my microphone. Hi, everyone. I'm Bree. I'm a bunny VTuber that one day turned into a pixie girl as well. I'm so excited to be here. I'm so happy.
Is that really your lore?
Yeah.
Is that really your lore?
Yeah. No, I was a bunny girl for 5 years, and then I decided I want to have elf ears. And so I turned into a pixie girl, and then I used that as an excuse to get a magical girl transformation and pay $6,000 for it. And that's it. That's my lore. All right, noted. I don't want to hear shit about Dr. VTubers Saiken MD anymore. I didn't. Can you crop my fucking browser and be professional on stream? What else do I have to crop? I crop my goddamn top so it's like on me and pretty, you fuck. What? What about what? The top of your browser? Yes, crop that. But now there's like a giant black space. Move it up, make it bigger. It doesn't stay centered then. Do you know how to use a fucking computer? Oh my god. All right, is this better? Hold on, I gotta wait for you to catch up. Give me 15 fucking seconds. 1, 2, 3, 4. You're good? Yeah, okay, there you go. That's make it yeah, there you go. I'm glad you learned how to use a goddamn fucking like mouse. Jesus. 8 years BTW. Yeah, 8 years. That's why I was surprised. Is because you didn't know how to fucking like go live or how to use OBS. This is my second stream on YouTube. Okay, I don't. OBS is the same no matter what platform you use. You fuck. Anyway, today we're playing Doctordle. We will be playing Doctordle together. I will just be here listening to Bree's stream of consciousness, and we will see. Funny to stream. Oh my god. We will see if we're able to reach the correct conclusion. Doesn't that sound fun, guys? Doesn't this sound like a great idea?
All right.
This man has
do you,
diarrhea.
okay, you want to start with like your experiences with healthcare and like how you.
Shut up. I'm going. Okay. My experiences with healthcare. Presentation by Brie at Cookie Box. Okay, so in Glee, this man gets pregnant. Oh no, wait, sorry. The woman gets pregnant because they make out in a hot tub. And I thought that was genuine, that you could get pregnant by making out in a hot tub. They didn't have sex, by the way. And then I have ADHD and autism. I got that going for me. So like if this 30-year-old man with diarrhea has autism, holy shit, I'll diagnose him on the spot. Also, I have POTS, the white woman TikTok syndrome. I have that diagnosed. And and in Red versus Blue, there's mpreg, so I'm pretty well versed in mpreg as well. And then I learn more about mpreg in all the Omegaverse fics that I read.
Wait, there's mpreg in Red versus Blue?
Yeah, in like one of the early seasons as well. So like it wasn't like they ran out of ideas and tried to be silly wacky. No, they planned for it, and like him and his kid go on for the entire rest of the show, and like they both have major parts, and him being pregnant with an alien baby, like that's like a major like character build moment.
I feel like I would have remembered that.
It's Junior. He goes honk honk. Honk honk.
Oh.
Mpreg.
Oh. My chat is saying to give you an honorary doctorate.
Thanks guys. Oh, and I watched House and Scrubs, and I looked at the thumbnail for like Chicago MD. Oh, I watched the what's that? The Pit. I watched The Pit. So like I'm pretty well versed.
I feel like you've watched more medical shows than I have.
You haven't seen The Pit? It's so good. There's a woman with autism in it.
Isn't that the one with the Pippa shirt?
No. There's a fucking doctor. Wait, The Pit is the one with the Pippa shirt?
Yeah, isn't it? Oh, you're talking about Mel? Oh, wait, I like her. Dude, I'm just her. You ever just like dissociate in the middle of your shift and you start watching sensory fruit videos? That's me.
Holy shit, The Pit is the one with the Pippa shirt!
Yeah, the lady comes in with a Pippa shirt. I only watched like maybe like 5 episodes because it got kind of boring. Not boring. It just got like.
What's wrong with you?
It's not like boring. It's just like
for Mel and Langdon getting together.
Ew.
What the fuck? Oh, I'm sorry. Do you not see autistic women as being able to have, partners? You don't see them as being able to be like sexually viable?
As somebody who identifies with Mel, I wouldn't want to hook up with Langdon.
What's wrong with you? What the fuck? Have you seen him?
Do you agree that I am a sexually viable person by comparison then? See? Exactly. Now you don't want to think about it. Now you're
not Langdon. That's a hot man. I've seen you. There's no comparison.
What the fuck?
This is gonna be a great stream. I'm having a lot of fun.
Okay, well, you're only here for another hour. All right, we're splitting this stream up into 2 halves. We have you for the first half, and then we'll bring on Hazumi in the second half.
Can I briefly say, Mr. 8 years, that you didn't communicate that to literally anyone, and so everyone came on stream expecting me and Haz at the same time.
Yeah, well,
and that didn't happen.
Hazumi's rating in Final Fantasy 14 right now, so she won't be done for another hour.
Yeah, but like you didn't communicate that. That was the goal and like the expectation from the start when we organized like this whole thing. And you didn't communicate that.
You know what? I think I communicated it to her, and then we both just decided to keep you in the dark.
I already knew. I meant stream, you dumbass. I meant on Twitter, Mr. I spend most of my time on Twitter.
Oh, shit. You're right. Oh, Nani commented, yeah, I was hoping they would double team you. Anyway,
go sit in the corner.
Let's play Doctordle. All right. So imagine you're Dr. Bree at Cookie Box Hospital. All right. Yeah. You're an emergency
the MD stands
doctor.
For Cookie Box.
Mookie Docs. All right, Dr. Bree, you have a 30-year-old man presenting with 3 days of fever, abdominal pain, and diarrhea.
All right.
What are you concerned about?
Diarrhea is fine because like everyone kind of gets diarrhea. Like, did he drink like milk? Who gives a shit, you know? Maybe he has like the period poops and like he's just on his period. So like,
okay.
And like fever, maybe he just like was like warm and like he was in a blankie for too long. And then abdominal pain, like I get abdominal pain like all the time. So like who gives a shit really? I think the main issue that we need to consider is that it's a 30-year-old man and that means that he's like already doomed and like close to death. What's a diagnosis for like start making your affairs in order?
Like end stage cancer starting on hospice?
Yeah. Can I just type in hospice?
I don't think that's a diagnosis.
Oh wait! Anti-phos. Wait, it came up. Oh my god!
Why would it be anti-phospholipid syndrome?
Because I know that one. I recognize the name. I know that one.
Okay, wait. Explain to the class what you think antiphospholipid syndrome is.
Okay, it's where your blood is too thick, so you have to move around a lot because otherwise you get blood clots really easily, and that's really bad. And so if you have it, you need to take baby aspirin.
Hazumi subscribed and TTS said, "Doctor, should I DoorDash Taco Bell?"
Yeah!
Yeah. Okay, but yes, basically it is, it's commonly associated with lupus and other autoimmune disorders, but...
It is?
Yeah, no, that's why I thought you said it, because it was like a lupus joke.
Oh no, I just might have it.
Oh. Okay. All right, well, yeah, so antiphospholipid syndrome, what they're talking about is you have antibodies that are not against like viruses or bacteria, but they're against your own cells, specifically the anti-cardiolipin antibody or the anti-glycoprotein antibodies react against your platelets, and they activate these platelet endothelial complexes, and that makes a lot of blood clots in places where it shouldn't be. And the problem with that is that you form blood clots, and young women who are of childbearing age will also have recurrent miscarriages. So, you know, in anybody who has, you know, maybe, I would say probably two or three recurrent abortions before 10 weeks of gestational age, you actually do need to do this anti-cardiolipin workup, because that is a, you know, genetic problem that you're going to be able to suss out through their recurrent abortions, and you'll also be able to prevent them from having blood clots in the future by giving them blood thinners.
Are you done talking? I tuned out.
Yeah, I'm done talking. Do you want to diagnose this 30-year-old man?
Yeah, they have antiphospholipid syndrome.
Okay.
He reports back that the symptoms started the day after attending a backyard barbecue. Ooh, he has foot and mouth disease.
Okay, foot and mouth disease.
Isn't that the one with the cows?
Is foot and mouth disease associated with cows? It's associated with it's Coxsackie virus.
What the fuck is that?
Coxsackie virus? It's the virus that causes hand, foot, and mouth disease.
Wait, what's the one that British people had with the cows? The thing.
I mean, are you thinking of like bacteria? Are you thinking about
the cows?
So there's mad cow disease, which is a prion disease, which is scary. Mad cow disease.
Oh yeah!
Do you think that's right? All right. Okay, so we're not okay. For mad cow disease.
Because there's a barbecue. You eat. Oh, sorry. You have to explain. Okay, cool.
Okay,
Yeah, sorry. I'll go back to my Animal Crossing.
I'll go fuck myself, I guess. All right. So mad cow disease is a prion disease. All right. This is characterized by misfolded proteins, and proteins are scary because your proteins fold in a certain way to work. And if they're not folded correctly, they will start to basically corrupt other proteins and cause them to fold incorrectly as well. And then these non-functioning proteins will basically start globbing up and tangling together. And that leads to severe neurodegeneration. They'll start having deposits in your brain or other organs. And mad cow disease, things like Creutzfeldt-Jakob disease, they're very scary because, you know, these misfolded proteins can exist on surfaces, surgical tools, hospitals, and it can start infecting and basically just spreading very quickly. So yes, you can get mad cow disease by consuming the misfolded protein of a cow, although you wouldn't necessarily be concerned with 3 days of fever, abdominal pain, and diarrhea. You know, you'd probably be like coma.
If it was up to me, I personally would be more concerned with fever, abdominal pain, and diarrhea from the mad cow disease. But that's because I'm built better. Can't you get prion disease from eating like human brain?
Yeah, that too. So I think that's called kukru. Kukru?
No, that's from Zelda.
Kukri. What's it called? Kuru. Oh, it's called Kuru. Okay. Yeah, so Kuru was found in the Foray people of Papua New Guinea, and these people practiced cannibalism of the dead, and like that was how their culture believed that like freed the spirit from the dead. So eventually, like one of the villagers developed sporadic CJD, which is Creutzfeldt-Jakob disease. And then when all of the tribe ate that deceased person's brain, they all started developing it. So that is a pretty famous prion disease too.
I regret mentioning anything about it because I didn't realize that mentioning something about it would lead to you explaining more things. I'm so sorry, chat.
I'm here to be the explainer. You're here to be the doctor. I'm not the doctor today. I'm just here to talk about how wrong you are and how your symptoms and your diagnoses aren't matching up at all.
What do you mean? I think that that's totally valid. There's a backyard barbecue and then he gets mad cow disease. I think that that's fine.
Well, you got it wrong, so...
Okay, yeah, it's because the website is wrong, but that's fine. So he reports the diarrhea was initially watery. That's disgusting. But today, several episodes became blood tinged. I feel like that's maybe he just needs like to flex less, you know, or like wipe less hard.
Like you're worried about hemorrhoids?
Yeah. Like maybe it's like two things at once. I learned that from I was gonna say Hamilton House. It's like Occam's razor, but like not Occam's razor.
Hamilton's razor.
Hamilton's razor.
All right, so you think he just had food poisoning from the barbecue that caused him to get the diarrhea?
Yeah.
And then he separately had like, an external hemorrhoid.
Like wiping too hard and like cut himself or something because of the diarrhea, because he was like grossed out by it, and he was like, I gotta wipe with this like rough cardboard, you know?
Okay.
And then he started getting bloody.
Okay.
What's the doctor term for food poisoning? Oh shit! I got that.
Gastroenteritis. Wait, they have ARFID?
Yo! This man's got ARFID, I've decided.
Why are you looking? Why did you click it? You already gave me an entire explanation. You gave me an entire explanation for this wonderful theory.
But I got ARFID did. It was like a Brie mention, and I felt seen by the website.
Do you want to educate? Do you want to do the talking? Do you want me to go play Animal Crossing and you can do the talking for this one?
Hi, chat. Briat Cookie Box here. Dr. MD Cookie Box. I got ARFID. It means being a picky bitch. I don't eat food good. And it's really annoying. End of explanation.
Okay, I don't think you explained your okay. Do you want me to explain ARFID like the way that I know ARFID?
Go ahead and explain it, speak for me, of course. Yeah, speak over me, explain my symptoms and my disorders.
I'm not trying to mansplain your experience. I'm just saying that you're not necessarily presenting the full view of the condition that you live with.
Oh yeah, I could tell them the egg cup story.
Oh my god, I just saw the word egg cup in chat and my heart sank. Go ahead.
Oh, can I?
Yeah, it's my stream. I don't give a fuck.
Okay, chat. Okay. So, I'm very bad with eating foods, and for me specifically, ARFID makes it so I'm very bad at eating foods that I've never had before, and it makes me really uncomfortable. It's not that I have like an allergy to them or anything like that. It's just that I'm like there is like a brick wall in front of my mouth the minute I go to eat a food that I've never had before.
Hey, that is a perfectly great explanation of ARFID, by the way.
Anyways, so I had this inability to eat foods that I've never had before, even like something so specific of like the example I always bring up is like I love red bell peppers, but I've never had like green bell peppers because I've never had them before, and it's literally like I cannot get myself to eat that food. Anyways, so I had a partner, and So I've never had semen before, and I came to that partner. Funny. So I went to that partner and I was like, look, I got this thing where I didn't know it was ARFID at the time. I just like, I'm bad at eating food that I've never had before. And cum is one of those. So I asked him, and like the way that I get more comfortable with stuff is if I do it in babies. If I do it in baby steps. And like if you're giving head, it kind of spurts out of there with such rush and fervor that I would feel uncomfortable with it. So I was like, I need it in a receptacle that will make me be able to have baby steps with getting comfortable with this food I've never had, and like take like tiny bites, and so I asked him to deposit his load within an egg cup because it would be a small enough load and it would blend in color-wise with the surroundings because I have like ceramic egg cups. So I thought that would be the most acceptable format for me to become more comfortable with said food that I've never had before. And then I didn't realize that was weird. End
Wait,
of
so
story.
did you ever actually?
Yeah, but it wasn't in an egg cup.
Did it work?
Sorta.
Oh.
Not really. And I wasn't with him long enough to like
test it out, repeat your hypothesis.
Like it's baby steps, and like I need the like there needs to be growth happening, and we weren't together long enough to make the growth happen. No fault on my part. I am good at making growth happen. That's a penis joke. But yeah.
Hey, Lev is in the chat, and Lev said this is a great, exposure therapy. I don't know if that's an official psychiatric endorsement, but you got one person rooting for you.
By the way, my mother at Thanksgiving Thanksgiving took a picture of a collection of egg cups and then tweeted it and then added me and said, I miss you. Just saying. My mother!
I need to talk to your mom more.
No, you don't.
Why?
Because I don't want her.
I feel like it would be such an eye-opening experience.
Actually, no, it would explain a lot. It really would.
Oh, I just got a Twitch raid from Zumi.
Oh my god, hi, Zumi!
Well,
hi.
welcome
Shut
to
up, Saiken.
Bree's
Shut
Egg
up.
Cups.
Hi, Zumi!
I guess okay. For context, we're playing Doctordle. We are listening to Dr. Bree's diagnoses and kind of cross-examining where the inconsistencies are between the symptoms and her diagnoses. But we're doing a little bit of learning, all right? We're seeing what people do and what people think about our different medical conditions and how they actually differ from what the answer might be. Bree decided to search up ARFID in the diagnosis box, even though she gave a wonderful...
I typed in food, fucking, what's it called? What is it called when you can't eat food good?
Like...
Food poisoning. I typed in food for food poisoning. I forgot the word. Shut
Gastroenteritis?
Bitch, I don't know. I typed in food, and it
You're
came
on a
up
much
with
warmer
ARFID.
track with gastroenteritis, by the way. If this is what I think it is.
Spoilers.
But, oh my god. Anyway, you typed in food and you got ARFID, and now you're explaining your experiences with ARFID, and I am validating by giving you a platform, and... yeah. Okay, can I mansplain ARFID now?
Go ahead. No, it's fine. Speak for the woman. Once again, sure, whatever.
So ARFID, ARFID is avoidant / restrictive food intake disorder.
But you're just reading from the website.
No, this is what I already know about ARFID. All right, so it is not necessarily an eating disorder like anorexia or bulimia. But it was kind of just like what Bree explained. It's not that you have a negative association with your body image or some sort of, psychological dysfunction with eating. It's just that sometimes you see a food and you just hit a wall and you just suddenly do not have an interest in eating it. So it's...
Look at you using the same terminology that I used.
I'm repeating that as a good example. All right, I'm saying that I'm validating your experiences by saying that's a very common...
Thanks, I feel so validated now. A male doctor has talked down to me about my own disorder.
Where's Lev? Can we just replace me? Can we just replace me with her? Can we get a psychiatrist on here to just do all the psych questions? This isn't even a psych question, it's a GI question. Why are we talking about this? Man, I can't wait until Hazumi gets here. We actually attempt to diagnose patients.
I think that she should be inspired by what has gone on and transpired already.
Inspired to hang out with your mom more? Yeah.
I mean, again, it would explain a lot. Every time someone comes from a conversation with my mom, they're like, I get why you are the way that you are now.
All right, anyway, so it's not ARFID. You want to read the next hint?
You just did the VTuber. Also,
right,
I want to point out real quick. Shut the fuck up. Shut up. I want to point out real quick. I'm aware that he was praising me. However, it's really fun to make him upset, okay, chat? You need to know that this was my whole purpose going into this, okay?
Grown-ass man, just trying to do some education on you. You know when I give this to my editor and ask him to cut down the VOD, this entire first hour is just gonna be unusable.
Yeah. It's so fun because I keep interrupting when you do conversations and explanations as well.
There's a comment that says, so this isn't food poisoning? Some people are saying it's most likely a form of food poisoning. What do you think?
Okay, hold on. I appreciate you calling back to the original purpose. I filled 35 minutes of conversation, by the way. You had an hour planned of nothing, and I filled 35 fucking minutes of it. He recalls eating a new low-temperature smoked chicken recipe in which the meat near the bone appeared undercooked. This man, can I diagnose him with being a fucking bitch patient?
I guess?
Because he comes in and he goes, hey, I have 3 days of fever, abdominal pain, and diarrhea. And the first thing after that out of his mouth is not, oh, I ate a new type of chicken that looked undercooked. That should have been the first fucking thing that I don't even care about the fever and abdominal pain. I don't care. You say, hey, I ate raw chicken. It might be salmonella. There you go.
Okay.
How do I spell salmonella?
Salmonella is a good, yeah. It's a good diagnosis.
With typhoid. Why does it have typhoid next to it?
There's Salmonella enteritis and Salmonella typhus.
Oh wait, enteritis. I recognize that from House. What's that mean?
Enteritis just means like inflammation of the digestive tract or like the small intestine. So gastroenteritis means inflammation of the stomach with the small intestine. Gastritis is inflammation of the stomach. So it's just describing where the inflammation's actually happening.
Why is there only one?
Doctordle is weird and only has like a few select diagnoses. It's not like it has like every single diagnosis under the sun.
But it got ARFID!
Yeah, I'm actually surprised.
Autism.
Probably.
Yo!
There was a selective mutism on another one that we did the other day.
Yo! What's selective iguana A deficiency? LGA? IG? What is that?
So it's when your body doesn't make IG immunoglobulin A correctly.
Thanks. Fucking thanks. Oh, selective IgE deficiency. Oh, it's when you have a deficiency in IgA.
Okay,
great.
Okay. It is a deficiency where you don't make IgA, and because of that, your body actually recognizes normal IgA as like a foreign threat because it's not, you're not making immunoglobulin A, so you make antibodies against immunoglobulin A. And this is a problem when people actually go to the hospital and they need blood transfusions and stuff, because when you don't have IgA and you react to IgA, when they get transfusions, they will actually start attacking the blood that's coming into their system because they don't recognize this normal antibody as a normal thing. I think selective IgA is actually the most common primary immunodeficiency, actually. Yeah.
Like when you get a kidney and it starts attacking the kidney.
Yeah, that's more like transplant rejection, but it's the same kind of thing, right? Like you're seeing a foreign substance and you start attacking it. So that's why people with kidney transplants need to take immune suppression medicines. So like tacrolimus, steroids, mycophenolate, and these sorts of things help modulate the immune response so the body doesn't overreact to the new kidney and, immediately starts ganking it after it gets transplanted. Okay.
Several things to address here. First off, you referred to it as start ganking it, which is embarrassing for you in so many different ways. Second,
because
I really
I'm 31 and I play League of Legends?
Yeah, guys, chat, do you know what the fuck he was listening to right before stream? Fucking lo-fi League of Legends music.
It's what's playing on stream right now!
It's playing on stream right now? That's so embarrassing for you!
Nani said, don't say gank, grown-ass man. That's not a League of Legends term. That's like, that goes back to like MMOs and like PvP.
Oh, it goes back to, stop trying to be hip with the youths, okay? Second thing that I wanted to bring up, I really respect when I say something intentionally as stupid as possible, and then there's like a solid 10 seconds of silence as you try to come up first with how I got there, and second, how to turn it into something educational, because I just said garbage.
Yeah, I'm finding the clinical pearls in your fountain of diarrhea, and I'm finding these like gold flecks that I can trade in and create something meaningful out of, instead of just sitting there and taking it all. So sorry for trying to make something productive out of this 39 minutes.
39 minutes of rich content, dripping with content, oozing.
I'm pretty sure we can make like an entire VOD edit of just the shit you have said in the past 39 minutes.
Bitch, I'll give you a VOD edit. It's called youtube.com/BrieatCookieBox. You're welcome. It's right there. Speaking of which, hey chat, Briette Cookiebox here. Have you considered watching someone that's funnier than Saiken? Go now to youtube.com/BrieatCookieBox. Thanks.
I got a super chat for that. I got two euros from Acceptable Casualty 5319. Thank you. Sorry, I thought I was gonna turn off stream alerts. I didn't actually expect to be getting like super chats and stuff during this. Let me turn off the sound effects.
Don't
real quick.
Turn them off.
Somebody in my comments.
Have you seen your student loans?
Somebody in my comments was saying
you can get.
it was loud and they couldn't watch the VOD because it was so loud.
Okay, that's when you turn them down. You don't turn them off.
I'm turning them down. I'm muting them.
Don't mute. Just turn them down.
I said I'd mute them. Anyway.
To that one person in the VOD, just letting you know that on my channel, I have everything properly, like audio coded to the correct levels. So you never have to worry about your ears being blasted by alerts or anything like that. So you can feel safe on my channel. youtube.com/BrieatCookieBox.
youtube.com/BrieatCookieBox. youtube.com/BrieatCookieBox. Bro, you know the people that I like took a screenshot of the chat the other day and they were saying like, oh man, he's streaming at like 5 a.m. for me, like, oh, he's streaming at 4 a.m. for me, oh no, I can't watch it live and stuff, right? Like they're going to look at this VOD and they're gonna be like, oh boy, another Saiken MD Doctordle stream, you know, chock full of wonderful information and great content. I really enjoy playing along, and they're gonna start with the first 42 minutes of this VOD and it's just going to be whatever the fuck this is.
Hey, there's 3 things that we learned all about. All of them I vaguely have an association with, so I didn't learn anything.
Can we get to one teachable moment where I actually say something that you didn't have a previous association with and you get to learn the correct information for once?
Okay. Go ahead.
I'm waiting for you to come up with another diagnosis. You were pretty close with
right.
You were on there.
What's dumb bitch syndrome? Because that's what this guy has for mentioning raw chicken fourth.
I mean, it's not that he mentioned raw chicken fourth. Like this is okay. It's Doctordle. It's like a game.
What's
it's like
yolk sac. That's like something from Subnautica.
It's a type of like germ layer tumor, I think. It's
Yo, rosacea! I know a rosacea! I know that one.
What is it? Is it like it's an ovarian tumor, I think? Probably. Whatever.
Oh, there's hand, foot, and mouth disease!
You were already, on a closer diagnosis pathway.
Oh, I was wrong! Whoa, get fucked!
I didn't think it was salmonella.
I did.
I know you did. But that's okay. Like in terms of Doctordle, this guy mentioning that he had chicken like in the 4th statement, like if this is a normal board question or like a normal like patient interview, you would get everything at once, obviously. But in terms of Doctordle, they only give you one statement at a time because it's like Wordle, right? You're not supposed to get it in like the first yes.
Can you put this next one into terms that I understand? Because I don't know what any of this is.
Okay, so this is just talking about the culture results. So this says stool culture demonstrates oxidase positive curved gram-negative rods that grow best at 42 degrees Celsius under micro aerophilic conditions. Okay.
Okay.
This is basically.
So you just read what it said back
because
to me.
I didn't read it for. Okay. This is basically just dog whistling every first year med student, because in microbio you actually learn like the random fucking facts about bacteria at this level that you never utilize in your clinical practice at all, unless you actually become like a pathologist or something. So there are certain bacteria that are oxidase positive, certain bacteria that are oxidase negative. Gram staining turns
Wait,
certain.
Oh my god! I just realized these are like vaguely Latin terms, right?
What about this is Latin?
The fucking with the part that's at the beginning of the word.
Stool culture?
No, the beginning of the word. Micro, bitch, and shit like that.
This is Greek? Okay.
Greek, I confused the two. I took both of them for several years.
Wait, I
both
did
of
too.
Them.
How do you not?
Yeah, no shit that you did too. You're a goddamn doctor. I'm a VTuber.
Yo, what's your favorite declension?
Nominative.
It's not a declension. That's it.
Yeah. No, I took 6 years of Latin and I took 3 years of Greek, and I remember oste mustus ente, which is the ending of words sometimes. And I remember 4 letters of the Greek alphabet.
What for?
What do you mean, what for?
Is it alpha, beta, omega?
No. Well, yeah, actually it was alpha, beta, gamma, because my school's floors, instead of like floor 1, 2, and 3, it was alpha, beta, gamma. And then I remember the sigma one, because it had two symbols, one for if it was the end of the sentence and one if it was in the middle, not because of sigma.
And you don't remember omega?
Oh shit, you're right.
Because that one's just impressive, honestly, right? That you just discounted the entire Omegaverse like that.
Well, no, it's because Omegaverse is so much more than just like a letter in an alphabet, you know?
It literally ends the alphabet. That's like the whole point.
But it's more than just an alphabet.
Okay, but
it's significant.
It's Greek.
Yeah.
Yo, somebody said
like,
everyone forgets upsilon. I didn't forget upsilon. I love saying upsilon.
In Dutch, it's upsilon.
You have upsilons in Dutch?
Well, no. When I learned Greek, it was when I was in the Netherlands. So we learned the Greek alphabet and the Dutch pronunciation.
Whoa, that's cool.
That sounded so sarcastic.
No,
what?
Fuck? No, I'm a classics
Christ.
person. Wait, I took 4 years of Latin and 3 years of Greek, and I took AP Latin.
So it's like instead of alpha, beta, gamma, it's alpha, beta, gamma, and then like delta, upsilon, zeta, eta. You know, it's just everything with the Dutch accent.
I think you just mixed up epsilon and upsilon.
No, epsilon.
How do you say upsilon?
Fucking, which one is that? Oh, upsilon. It's upsilon. And then epsilon.
Yeah, there we go.
Holy shit, wait, oh my god, I do know the Greek alphabet!
Yeah, alphabet,
gamma, delta, epsilon, zeta,
delta, kappa, lambda, mu, xi, alpha, kappa, sigma, pi, phi, psi, omega.
It's in red versus blue, saiken!
Everything comes back to red versus blue.
Yeah, it does.
You know what everything could come back to? Doctordle.
Alright, okay. Stool culture, that's poop. Demonstrates oxidase positive, like it has lots of air in it. Curved, gram negative. Okay, gram, that's like the Hulk. So it doesn't have gamma rays that don't grow good at 42, which is from Hitchhiker's Guide to the Galaxy. And it wants to fuck with that chocolate bar named Arrow.
Why is it a chocolate bar?
Because it's the era. It's the Arrow. Do you not know the chocolate bar Arrow?
No. What is the chocolate bar Arrow?
Okay.
I'm gonna look this up.
Okay, it's a chocolate bar named Arrow.
Okay, yeah. Did you just say the thing that I just said and repeated it back to me?
No, I just said everything that it reminded me of. Hoping that one of them would piss you off.
Okay, anyway, microaerophile means microaerophile. So phile coming from the Greek root philia, meaning to love, right? Aero for air and micro meaning little. So it loves thriving in little air, which means that it is a specific type of bacteria that thrives in low levels of oxygen. It's not completely an anaerobic bacteria, but it doesn't like ambient, like normal atmospheric air, which is 21% oxygen. This stuff lives at more like 2%, 3% oxygen.
So will this man be cured if you just blow on him a whole lot? Because it'll be like regular air?
No, because how are you going to get that air into his digestive tract?
I don't know, with like a syringe. What if he eats air?
No. No. Anyway, so like I was saying, how this question is basically just dog whistling first year med students. All of these, you know, random facts and what positive and what negative it is basically just kind of narrow down, you know, what organism it is. So yeah, salmonella was actually pretty close, right? So you're thinking about a sort of gastroenteritis associated with raw chicken. I think what's really going on here that you're more concerned about is the timing and the symptoms. So you're more concerned about a watery diarrhea that's turning into bloody, and you're concerned about something that happened about a day after it happened, or after he ate the chicken. So what
but
I
we're gonna
think,
ignore the blood-tinged diarrhea because he just wiped wrong.
right, because you think it's Occam's razor, and he just also happens to have an unrelated anal fissure / external
like the episode
hemorrhoid.
of House called Occam's Razor from season 1, episode 3.
How do you know that?
I was making up the number. I think it's around that, but
Should
that was the episode that I was
House
watching.
episodes? Should I start quoting House episodes by season?
It's actually really fun. You'll annoy the shit out of your entire chat because that's what I do with Community and Red versus Blue.
It is season 1, episode 3. What the fuck?
It is? Oh, hell yeah!
How did you get that?
Well, because you invited me to this collab when I was watching it.
Oh my god. All right. Anyway.
So what the fuck is this tally? It likes air, but like tiny air.
Yeah.
So what am I supposed to deal with that?
So
who cares?
Okay. Well, again, if you were a first year med student, you would probably know all these useless facts about different bacteria. But this one's probably going to be Campylobacter jejuni.
Okay.
Also Occam's razor. I think C. jejuni might actually be the most common cause of bacterial diarrhea. I think a lot of people default to Salmonella or E. coli, but C. jejuni is probably going to be my guess. I think E. coli would probably present more with a bloody diarrhea, and I think Salmonella would have a longer incubation period before experiencing symptoms, and they wouldn't be, you know, this bloody this quickly. Also, they would probably give you some other thing where it like the bacteria is plated on hecaton agar and turns black or something. I don't know. That's like another random fact that you'd learn about bacteria in med school.
Okay, so how do you spell the thing that you just said?
Campylobacter. Camp. Please tell me it's right because I don't really want it.
Boo!
Right.
Boo!
Yay! We did it!
Boo!
We did it!
He was treated with supportive care and oral rehydration. Oh, so I'm sorry, so he was just... What does supportive care mean?
Supportive care usually just means like fluids, electrolytes, right? Because treating or like trying to kill the bacteria itself doesn't really do much. Patients improve more with repleting the losses from the severe diarrhea that they had.
So you went to the doctor and he was like, yo, I have this like clear issue, and they're like, damn dude, have you considered Gatorade? That sucks.
Well, I mean, they would also give you like intravenous like hydration, so they would give you fluids bypassing your GI tract so that you're not instantly, diarrhea-ing them out. And then what else? They would give you electrolyte repletion, right? If you're losing potassium, they would give you potassium, right? So it's not like they would just say, drink Gatorade, because there's no point drinking Gatorade if you're instantly going to diarrhea it out.
Wait, okay, I have a non-rage baity question for the first time in 55 minutes.
Okay.
Do you poop out liquids?
Do you not poop out liquids?
Well, because you said you diarrheaed the Gatorade out or the water out and stuff, but I thought you peed out liquids and you pooped out solids.
Right, but if you have a bacterial infection that's messing up with your digestive tract and your colon's ability to reabsorb water, that's what it's saying when it says watery diarrhea. This is what things like, dysentery or, traveler's diarrhea are, that they inflame your colon and your digestive tract so it can't reabsorb water normally. So all of that water just ends up flushing out through the back end.
Oh, so when you have diarrhea, that's what makes diarrhea. That's the liquid?
Yeah, so there's a couple ways. I mean, there's secretory diarrhea, osmotic diarrhea, but ultimately it really just means that there's a lot of water left in the tract, and that is all going out at once.
You know what? I'm just now realizing I never really considered why diarrhea was diarrhea. I just kind of thought that your body just mixed it up a lot more, so it was more liquidy. I don't even consider the fact that it was just water going in there too.
Ultimately, if your body was mixing it up a bit more, like your body was churning the poop in your colon a bit more, that actually gives you softer stools. So
that's what I thought. It was so soft it was smoothie, and then it turned into liquid.
Well, smooth can be good, right? If you're constipated and if you're constipated.
Oh, sorry, I don't listen to you, so it's hard to trigger my brain to start doing that.
Okay. If you're constipated, you can take different stool softeners, that kind of slow down the transit time in your gut and allow your gut to start, mashing on your stool ball, for lack of a better word. And that, constant mashing and mushing and pressing in your digestive tract actually allows you to pass the stool.
If I eat, a marble, that would hurt and stuff. Okay, yeah, whatever. But would that technically also make my shit more liquidy and easier to shit out? Because it's mixing it. It's like when you have a smoothie flask and you put a little ball in there so it mixes up your protein shake better. Because I know, crocodiles do that. They eat oysters and then they eat rocks after, or clams, they eat rocks after to crush it all up so they can swallow it better. But, would that work for me, too? Okay, so the marble example and the example that I gave with, psyllium fiber are more two different things. But actually, you're on the right track, okay? So do you know what Metamucil is? No.
Google Metamucil, put it on the screen right now so everybody knows what Metamucil is.
Metamucil. Hold on. I gotta make sure I'm not doxing myself. Okay. Metamucil. Oh, it's a fiber supplement.
Yeah. So this is a bulk forming laxative. So Metamucil, you can take it as a drink, or you can take it like a pill or as a gummy. And it has these psyllium fibers in it that slow down your digestive tract because they basically bloom in your colon, kind of like a chia pet. And this...
Oh!
Yeah, so this helps the intestine kind of squeeze down, or it increases pressure in the intestine, and it helps the muscles squeeze down and contract so that it's pushing the poop through your system. And as you bulk up your stool, you're giving it more time in transit to slow down, to get softer, so you're not having tiny rabbit poops that are, constantly, painful to be pushing out. Another benefit of this as a bulk forming laxative is that it actually keeps you full. And Metamucil, that's why you always see it like heart healthy or like diabetes healthy, because it, you don't want to eat as much if your belly is full. If your belly is full of poop that's about to come out. So having Metamucil with your meals helps you space out your meals more so that you're not overeating throughout the day.
So back to the marble example.
So the marble example, this is like if you see in kids, so like you, if you swallow a marble, this is something called an ileus. So this is a mechanical bowel obstruction. And this is when like something actually gets stuck inside the digestive tract and it completely blocks it from moving forward. And this can be an issue because now, no matter how much pressure, how much squeezing the intestines are going to do, you're not going to get past that. And with enough pressure, right, that can actually perforate your GI tract, which means punch a hole through it. And that eventually, that can lead to, infections and sepsis. And that's something that's going to need surgery in order to fix.
What if you just like jump really hard?
No.
But like, very genuinely, is there something in your like GI tract or whatever that makes it so like outdoor movement doesn't affect it? Or can you literally jump so hard for like hours and fuck up your tract because you're like jumping around and you're messing it up?
I don't think you
You're
can.
a bad doctor.
You ask questions that all right, like
can your GI, like if I went on like Space Mountain Disneyland for 6 hours straight, would that mess up with my like GI tract because of the like changes and the like very quickly going down and up and all around and stuff like that?
No. Okay.
Why not?
Because your intestines are very tightly wound and coiled, and like if you
Just
Google,
like me.
if you Google up like a picture of the intestines, right?
Okay,
I'll
these. Google it.
Isn't this like the question you asked me like 2 weeks ago? Right? Like, is the skin the biggest organ, or is the GI tract the biggest organ?
Was bigger than an intestine. That's different. Now I'm asking if intestines are wibbly wobbly inside of a body.
Right. Intestines are wibbly wobbly inside of a body, but they are weird and wibbly wobbly in the sense that they always know where to go. Unless you have an obstruction or like a scar tissue adhesion or like a cancer foreign body that's causing your intestines to twist up in a certain way, leading to things like, obstruction from Mass Effect or volvulus or whatever, there is like a hidden code in your intestines to always know where they go. So
like intestines have like an inner ear thingy that always knows what. Okay.
Actually,
I read that when you take intestines out, you hang it on a hook and then it like wiggles and then you put them back and it just kind of like figures its shit out.
Exactly. Yeah. So when you do an abdominal surgery and you fix something and you run the bowel and you make sure everything looks good, when you shove the intestines back in there, they really just sort themselves out and they know where to go so that they don't like impact or twist on each other. And that's pretty cool.
Good for them.
Yeah, that's your intestines. Your intestines know how to do that.
That's so cool that something in my body knows where to go. Nothing else does, but that's cool that I got one thing. Can you make intestines shorter? Can you like surgically make them like just like a fucking centimeter?
Yeah, so you can like in like a Roux-en-Y bypass, you can basically just bypass a complete portion of the small intestine so that you're digesting less. And this is a very common bariatric surgery in order to help patients lose weight, because if you are absorbing less nutrients and you're pooping them out instead, your body will eventually start losing weight because you're not taking all the nutrients. Or in the case of like a gastric sleeve, your stomach is a lot smaller so that you don't actually, you feel full a lot quicker.
So if your intestines are smaller, does the intestine like can it adjust that? Can you personally interview an intestine to see if it's comfortable and if it knows it's shorter or not?
What?
That was half sarcastic, because no, you can't.
You can't interview an intestine.
Yeah, don't worry. That was half exaggerated, just to let you know.
Right, but like in people
does it
who
fill
have
the space?
Like, yes, in the sense that everything again goes back to where it should be, but you can cut out parts of the intestines for people, you know, who need surgical correction, and they will have less intestine than a normal person because you're essentially like cutting out an infected part and then stitching it back together. I'd imagine those intestines rotate back normally to where they go, but, you know, in general, you're also worried about like absorption problems, because what if a certain nutrient gets absorbed in a certain place and you had something in there like a bullet or inflammation from Crohn's disease and you needed to cut that part out? Then you're going to have malabsorption and you're going to have like a nutritional deficiency. Even though you're eating the iron or the vitamin B or whatever, if your body can't absorb it, you're functionally just pooping it all out anyway.
That's like why energy drinks have like 3,000 dose vitamin B, but it doesn't matter because you just shit it out.
Yeah, pretty much. I mean, actually you pee out vitamin B because it's water soluble. So with normal kidney function, you really shouldn't be overdosing on vitamin B or C, but specifically vitamin A, vitamin D, vitamin E, and vitamin K are fat soluble, which means that you can keep eating it and your body will absorb it. And if you have enough fat tissue, then it will build up into high enough levels where it can cause toxic effects.
Okay, follow-up question. Why did they name vitamins that like that?
I don't know. It's probably like the order they discovered
You're
them in.
You're a shit doctor!
What the fuck? I just explained like 7 things, and now you're telling me I'm a shit doctor because...
Yes!
You know what? I'm going to do the thing where I Google it and I'll figure it out instead. How about that? The word vitamin, originally vitamine, was coined by scientists...
No, I mean like the A and the B's.
I don't know.
It was the order they were discovered, but they were being quirky with vitamin B and K. Yeah, why?
Oh, because vitamin K... Oh, I know this one. Because it's by a Danish guy. And so vitamin K is an important coagulation factor. It helps in the creation of a lot of like clotting factors. So vitamin K is from the, I guess you would say coagulation with a K in Danish. But yeah, like this guy was like, it's the coagulation vitamin. So we're going to call it vitamin K.
Like, the whole naming system is stupid and I'm going to fix it. And then he didn't think of any other vitamins, so he only did one.
Yeah. I don't think these people were doctors either. I think they were scientists.
Well, like they're probably doctors, but like the cooler doctors.
Like PhD doctors?
Yes.
Yeah, probably. Because these guys actually do research, unlike medical doctors.
It's not fun when you go along with it.
No, but I personally
insult you.
No,
That's
but
not
I'm just
fun.
saying,
I
like,
don't want you to agree with me.
Like medical doctors, like med students and residents and like medical doctors, like a lot of us don't really do like the standard of research as, you know, demanded by academia, like true PhDs, like.
Yeah, but I don't know any of that shit. I just try to insult doctors as much as possible because you're one.
But I'm agreeing with you.
Yeah, I don't do that next time. What's the point of rage bait if it's not bait or raging?
I don't know, maybe you should stop doing it.
Who the fuck do you think I am?
Someone who took an hour to answer one Doctordle question.
Are there more? Can you have more? I thought it was a what a day thing.
No, they have like the full archives like out there.
Oh, I was gonna be honest. I was half stalling because I thought we just did one. Where's
this was
6,
supposed
7?
to be a whole stream.
Well, it is a whole stream, bitch. It is.
All right, are we looking up 6, 7?
Okay, hold on. A 19-year-old female? That's close to me. Oh my god, no, it's not.
You're not 19.
Oh god! Sorry, I haven't gone outside since I was 19, so I forgot that I aged. Abdominal pain and dissension.
Okay.
She doesn't like her government anymore. What does distension mean?
Distension just means like it's like bloated, kind of in like a painful way.
Okay, but okay. And then urinary frequency and constipation. Ooh, okay. Well, ignoring the constipation one, I get this when I drink water.
You can't just ignore symptoms in the presentation. Unless you're gonna say it's like Occam's razor, and she drank a lot of water, but she also took a bunch of opioids, and that's why she's constipated.
Yeah. Wait, can you get constipated from Adderall? Because then it's like basically me. She drank a glass of water and then she took Adderall.
I don't get constipated from Adderall.
I also don't get constipated from Adderall, but maybe she's just special.
All right, so she's got abdominal pain, right? Her belly is bloated, distended, it's bulging out. She's peeing a lot, and she's constipated. So when you're thinking about symptoms, think about how you can localize them physically, right? So urine, GI, and like skin, really. These aren't necessarily related by one organ system, but physically they all are happening in the same place, right?
Is she pregnant?
Yeah, right. Like if she had a baby in there and the baby,
But that's
something
so boring.
I don't know. Maybe she is pregnant. She's 19. It would be an interesting question, Stem.
Pregnant. There's no pregnant.
All right. Well, it could be like a tumor, right? If it's in the uterus, if it's in the ovaries, if something is blocking in that area and it's pushing down on her bladder, it's pushing down on her colon, right? It could cause all of these symptoms too, because her GI tract isn't mobilizing correctly, and because her bladder is constantly being pushed against. That's why she's having the urinary frequency.
I like ovarian theca lutein cyst because the theca lutein sounds like something from Warrior Cats. We're doing that one.
It's pronounced theca. It's the theca cells in the ovary.
Pelvic exam reveals a painful right adnexal. What's an adnexal?
Adnexal means that it's next to the ovary. Actually, wait, you were pretty close. Wait, so it could be an ovarian. It could be an ovarian tumor, actually. There are a lot, or like an ovarian cyst. Like it could be a lot of different things.
I like this one because the word fistula sounds really pretty.
Vesicovaginal fistula? Okay, so
I think fistula sounds like the name that I would give a child.
Do not name your child Fistula.
It sounds like a flower or something.
Fistula at Cookie Box. All right, so a fistula is a connection between two things that's abnormally there and, doesn't normally exist. So a vesicovaginal fistula is talking about a connection between the vesicle, which is the bladder, and the vagina, right? And a common symptom of a vesicovaginal fistula is going to be that you're going to be urinating out of the vaginal opening. So
I was pretty close. Wait, no.
No, she doesn't have that.
Maybe she's peeing frequently because she's peeing from two holes.
Okay, I feel like she would have complained about that first.
And maybe she just didn't realize,
Okay.
Also, can I be crude?
Okay.
When you're having sex, is a penis a fistula at that point? Because it's like a item in there that shouldn't be there?
No, a fistula is a tract that's connecting two things that shouldn't be connected. So you can have some pretty gnarly fistulas, like I was talking about Crohn's earlier. From the inflammation in Crohn's, you can have the wall of your colon basically erode into another organ. So you can have like colovesical fistulas, you could have colovaginal fistulas, where basically like you're going to start pooping out of your vagina because like that wall is eroded and the stool is falling through that tract instead.
That must feel so weird. Can you imagine having that, but like using like vaginal eggs at the same time? So like you plop them out and then like they just keep coming because you just there's more shit coming out. Literally, that'd be so weird.
There's a YouTube comment that says, "I love whatever is wrong with her."
Thank you. Me too.
Anyway.
Nani, don't just put question mark, you bitch. The other people, they're entitled to put question mark and ... It's just Nani just can't.
It's just him specifically.
Yeah. What's HCG?
So, beta HCG is human choriogonadotropin. This is a chemical that's secreted by the placenta when it forms, and it's going to be what's detected on a urine pregnancy test. I think Scarla was talking about this at one point, like what happens if I take a pregnancy test when I'm not pregnant or something, but that's basically the chemical that it's looking for. And if you are pregnant, then you are going to be peeing out a lot of HCG, and that's what's going to be detected on the strip.
Oh, that's how pregnant. Okay.
And if you're not pregnant, then you wouldn't. But the fact, yeah, okay. So that doesn't necessarily rule things out, but either positive HCG in somebody who swears that, you know, they're not pregnant, they're not sexually active, that would, you know, kind of prompt us to start investigating for a tumor or something that could be producing HCG by itself in the absence of a fetus.
I see. Like Jane the Virgin. But like not at all.
Who?
You haven't seen that TV show?
No.
No, it's this woman who's saving herself for marriage named Jane.
And she's a virgin?
Yeah, she's a virgin. And she goes to her doctor for like a regular checkup with her vagina. But then next door, there's a person that's trying to implant sperm in her vagina, and the doctor gets the mixed up, and so she gets sperm implanted in her vagina accidentally, and then she becomes pregnant. So there's like this whole like virgin pregnancy, Holy Mary kind of thing.
Okay.
It's a great TV show. It's like a telenovela, so it's like really, really dramatic, and like it's really entertaining.
Okay. Anyway.
What's LIDA?
LIDA? Oh, lactate dehydrogenase.
So like milk?
No, so it's specifically lactic acid, which is what it's concerned about. But a mild elevation in LDH is usually something that you'd see in like cell death or specific types of tumors that are causing a lot of high turnover of cells. Yeah, it's a pretty non-specific finding. I mean, you could find a mild elevation in LDH in a lot of things. It's not like a super red flag screaming symptom towards, yeah. To be honest, I'm not sure which specific. I mean, obviously it's a tumor. Like I think it's going to be a cancer. It's either a tumor or a cyst that's pressing against the adnexa. It's causing all of her symptoms. It's just you need a lot of lab work to figure out, you know, where we're going. But maybe, you know, we can follow the rules of the stream and, you know, try to use the internet to see if you can diagnose it before I can.
I'm using my rules of the internet.
You're using Jane the Virgin knowledge?
Yes! Okay. So she got something that hurts and she pee a lot and abdominal pain, ouchies, and constipation. That must be so annoying. You're constipated, but you're going to the bathroom, but like every time you go to the bathroom, you're like, damn, like I really want to take a shit, but then you can't. You just end up peeing more. Like every time you push to go poo, you just pee. That'd be so frustrating. Maybe she's actually wrong and she actually has diarrhea. She's just misidentifying holes.
You think a 19-year-old female would misidentify her holes?
You said the word hole.
Let's just say that it's not two separate things, and she's not, you know,
You don't want season 1, episode 3, Occam's Razor House? 2007 or whatever?
I think the most Occam's Razor thing is to follow the prompt as given and investigate her HCG and an elevation in LDH.
Yeah, but you said that mild elevation was who gives a shit, so I'm just ignoring it.
Well, I'm talking from the perspective of an internal medicine doctor. I'm not really sure where to go from this. Like, I don't have like a red flag diagnosis that's screaming at me right now. So
ooh, okay, cool.
That's why I was saying, like, can VTubers use the internet to outdiagnose a doctor? That's what Hazumi's gonna do whenever she's done rating.
Sex cord theocoma.
What?
I don't know. I have a toothbrush on my desk that's Colgate, so I typed in Col, and it came up with sex cord theocoma, and sex cord is near the ovaries.
Okay. Okay.
What's a sex cord theocoma?
It's another type of thecal cell tumor. Like,
so I am in the right area.
Yeah, you are in the right area. You're a lot more in the right area than when you were trying to diagnose that guy's C. jejuni infection as ARFID. You're at least in the right, like, zip code this time.
What's serum AFP? That's a Bruno Mars song.
A serum AFP is a Bruno Mars song.
AFP.
Apatu. What the fuck? All right. The serum AFP is serum alpha fetoprotein, and it's a specific type of marker that's given off in specific types of cancer.
Okay, so she has cancer. So now Wilson comes in. V2 is in this episode. Okay. Wait, can it wait, someone said it in chat. Can it be the yolk sac tumor?
Oh yeah, probably, right? Because
yeah,
it's AFP, and then that next one. Yeah. Wait, no shit. Wait, you got it. Wait, you got it. Dude, the Bree beat me. Bree at Cookie Pox beat me. Honestly, I don't even. They name drop Schiller Duvall bodies in the last one. I don't even know if I would have gotten it there. Like, this is fucking step 1 is hell, or step 2 is hell. Like, I would not know where to start with this. This is where I like refer to OB-GYN and then be like, ovary help.
I'm thriving. Oh my god. Chekhov's gun fired.
Why were we even talking about yolk sac tumors in the first place?
Because I typed it in and it came up and it sounded like a thing from Subnautica, and I played Subnautica today. It was just on my mind.
What are the odds? And it's fucking 6'7"? Like, oh Woo! My god. This is painful. Someone says, I aspire to be as confident as her.
You should. It's actually great.
The cessation of laughter when Bree said, I should be a doctor.
I get nothing done because there's a mirror in my living room and I just stare at myself, but it's really cool to be confident.
Oh, so you're a dermatologist is what you're saying.
No, I'm good. I'm a VTuber. It's so nice to meet you.
Where's Hazumi?
Yeah, it's like, we should have done a chart of like how excited you were at the beginning of this, and then like how much you wanted to kill yourself like around this point.
Yeah, it's like it was like a 6, 7. Now it's like
that's funny.
Now it's like a 9.
Chat, did you know that in Saiken's Twitch panels, under Twitter, it says specifically, I am most active on Twitter? That is a 31-year-old man who's a doctor formally, has a degree in everything, and he is active.
Has a degree and has a license. I finished residency.
Yeah. Most active on Twitter. That's so embarrassing.
I don't understand why that's a problem. I can't stream every day, but
you're a fucking
I can shit post on the toilet every day. That's easy. Because I have regular bowel movements and I poop at least once a day.
Do I poop once a day?
I don't know if you do, man.
It would be bad if you did.
Oh my god, Hazumi is ready. I'm saved. I'm saved.
Can we redo that?
And
like maybe have less relief in your voice? God damn, I get you want to flee, but
oh
shit.
God, Hazumi's ready. I'm sorry we gotta cut this short.
To everyone in chat that's like, whoa, this is the funniest stream I've seen in a long time. Whoa, I've never laughed out loud as like this many times. Hi, I'm Brie at Cookiebox. You guys should go to my channel. Did you know I have music on Spotify that I made myself? It's about self-cessed. Hi, how's it going? I just figured I would need to get some self-pro in there since I'm gonna be kicked off pretty soon and never invited back.
Is this the first time we actually just like had a conversation?
Yes, this is the first time that I've heard your voice other than the 30 seconds where I met you.
Damn, that's crazy. Let's keep it that way. All right, everybody, say goodbye to Bree.
Goodbye.
Thanks for stopping by.
See you later. Goodbye.
Goodbye, Bree.
Bro, who the fuck was that dude? Fucking weirdo.
Bro, this was a lot. This was a lot. Like, I'm not saying that I didn't expect that. I just thought we'd do more than 2. I thought we'd be able to do more than 2 Doctordoles. Who the fuck was that? I felt like I got to be educational. Right? You guys learned something, right? Do you want one of my cigarettes? Honestly, fuck it. You guys learned stuff. You guys learned about yolk sac tumors, right? We talked about Creutzfeldt-Jakob, right? We learned about beta HCG and what it does in a pregnancy test, right? Yeah. We're doing. God, I'm deeply upset that she got one right in the end. No, that was the point of this stream. Okay, so ideally, I probably would have had Hazumi on first, but she was raiding. But I mean, I did want people to approach this Doctordle scenario like if it was them Googling up their symptoms and seeing like what the internet can actually give you, you know, in these cases. Because, you know, let's be real, like a lot of people look up their symptoms before coming to a doctor, right? And you know, how to see, like, does this actually lead you more astray or does this reassure you? Like these sorts of things I've never actually tried on my own, right? Because I usually I self-diagnose. Is it still self-diagnosis if you're a doctor? But you know what I'm saying, right? Like it's Doctordle, it's not a real scenario, but is WebMD, are these sorts of tools that a lot of people do use good enough to actually approach these conditions in the same way that a doctor would think about it? The patient knows they have a gram-negative microaerobic bacteria. Okay, I did say that one was really just like a first-year med student call out right there. All right. Plot was going nowhere. All right, let's see if we can get a better a better victim here. Let's call Hazumi. Let's see if she picks up. She's not picking up. I fear it might be cooked.
Well,
Hello.
well.
Hello and welcome. Welcome to the Doctordle stream.
Hello.
I'm gonna turn you up a little bit. Say something.
Hello.
Talk about something. Talk about how your raid was.
I feel like we progged. I think it was mostly like a derusting session. But I think we're getting comfortable with like, well, you don't know about T, but like the Nises.
I know
stuff.
T. I watched my friends do T.
Oh, let me share your stream. Hold on. My Discord. Yeah, so I think we're getting more comfortable with the Nises. We pretty much finished that like section. We're at like, you know what BPOG is? We have to exchange like the last Nises for the judgment.
Mm-hmm.
And yeah, that's about it. So we're not at time stop just yet, but we're almost at time stop. I'm so excited to see it.
You know what the secret of
Shut up.
telling him?
Shut up.
It's all
Actually, you
in
can do it for chat. Go ahead. Okay.
Okay, so in the Alexander series of raids, there is a time stop mechanic, and like the music pauses, and there's like the screen pauses, and it's really funny, and he attacks you while you're paused. And when the band, the Primals, performs it live, they also do the time stop thing too. And it's a really cool moment, and I was at FanFest, and I was finally able to do it with the crowd, and it was awesome. But you know, whenever we get Alexander in roulette or something, I always do the joke right before the time stop goes off, and I'm like, you know what the secret to telling a good joke is? It's all in the timing. It's all in the timing. All right. Anyway, so for the Doctordle stream, I would like you to open a browser and share your screen.
Ooh. Okay. Let me do one where you can't see my tabs. Hold on. Give me like 2 minutes. Oh, it didn't open a new window. That's weird. Oh, there it did. Okay. Hello?
Oh, just share that new window with me, and then I'll put that on my stream.
Wait, but I don't know what the website is.
Oh, it's doctordle.com, I think. Or you could just Google Doctordle.
Not loading. I might get a virus.
Oh, sorry.
It was
doctordle.org.
Oh my god, you're trying to get me a fucking virus on my computer.
Okay, now I'm gonna pop this out.
Wait, wasn't this on your stream? Good thing I didn't look at it.
Yeah, we're gonna start from 68.
How the fuck do I find that?
So
Archives?
on the left, you're going to go to archives.
Uh-huh.
And then you're going to scroll down to 68. So we just did 67.
No!
And Bree got it correct.
Dang.
That was me going, no!
I'm kind of sad because I didn't realize this is how we were gonna do it. So I was gonna cheat by getting everything wrong and then looking out what the answer is and then telling you what the answer is.
Why would you do that?
It makes me look smart.
Why would you hate me like that?
I don't.
All right. There is a question that says, "Wait, is Hazumi also a Zoomer?" Why don't you introduce yourself first?
Hello, I am Hazumi. I'm a Linus Knight, a VTuber here to protect you forever. I primarily stream at this point Final Fantasy 14, and I sing. Yippee! And no, I'm not a Zoomer. I wish I was a Zoomer. My birthday is next week, and I will not say how old I will be, but it is not good.
It's younger than me. You can say that.
Barely. Why would you say that? People know how old you are, you stupid bitch.
That gives you a 31-year range to guess. That's not very specific.
It is very specific.
Oh my god.
It is very specific. Just don't say anything ever again, okay? Anyways. Yeah, I'm 12, guys. Actually, no, I'm not 12. He'll get banned if I say that. Anyways.
You hate me.
Yeah, my birthday is actually 6/7. That's why. But no, I wish I was a Zoomer. Some people are like, I'm so old, and they're like 21, and I'm like, you should die. You know? You know?
You know?
No? Okay. Anyways,
let me start opening this up because I have to reset it from Breeze stuff. So,
okie dokie.
Where's the capture?
Yeah, I told my chat I'm answering medical questions today because I'm definitely a doctor.
Oh wait, I opened this. Oh shoot, I opened this one up already.
No.
Okay, so we're gonna have to start with 69 actually.
Okay. Oh, nice. Well, because I was looking at your stream and I was like, why are you doing the answers already?
I thought that's what you were trying to do. Like you were trying to click through all of them and then do
No, I said that's what I wanted to do.
Yeah, I thought you were doing that. So I was clicking through and I was gonna be like, what is she gonna say that's gonna like be a buzzword that I can be like, are you looking at the answers?
Lamau?
All right,
No.
so I guess we're gonna have to 69.
Okay.
We're gonna have to go to 69.
Sorry. Yeah, maybe I am 12.
Your screen is very wide, but
my screen, I have a larger monitor. I'm sorry.
I guess I just gotta.
I think it's like a 27-inch. It's pretty big.
How do I do this? Why are you so wide?
That body of yours is absurd.
The body of yours is absurd. All right. So actually, you want to zoom in on your thing so everybody can see what the question is? All right. And then I guess the other thing that I had Bree do was just like introduce your medical expertise, medical comfortness. What kinds of things do you do when you need to go see a doctor? And like, have you ever Googled up like your symptoms and tried to come to a conclusion before?
I am definitely a hypochondriac, so I try not to Google my symptoms because I know if I see something on WebMD, I'm gonna think that I'm dying. And I'll start developing these symptoms where I'm like, oh, this is definitely bad. There was one time, I watched this Japanese movie where this guy develops a brain tumor and then dies. And right after I watched that movie, my head started hurting really bad for like a week, and I kept trying to convince my mom that I had a brain tumor. So, not good. My medical knowledge is subpar, but I think it's getting a little bit better. And what was the other question? What do I do? Oh, I feel like I go to the doctor relatively often. There are some things that I have to like schedule that I hold off on, but general checkups, I think I'm pretty good.
That's good.
Yeah.
That's better than a lot of people.
Thank you. I know.
I mean, I think like even if you have trouble getting to see specialists or, you know, following up on very specific problems, I think at the very like minimum, people my age, right? People in their 20s and 30s, I think, should be in a position where they feel comfortable making a doctor's appointment, right? At least seeing their primary care doctor once a year, right? At least knowing who their PCP is, right? If somebody asks you like who your PCP is, like you should be able to give the name, right? You shouldn't be like, oh, the doctor that I saw like 6 years ago for like a high school physical that I never saw again after that.
Yeah.
Right. I mean, as we get older, like emergencies can happen. You can be in the hospital. Like somebody needs to know your records and where to get them from. And knowing who your primary care provider is a huge step up from not having one in the first place. So
yeah, I think there was like a difficult transition because my pediatrician that I literally saw since I was a baby was like my doctor, like again, since I was a baby. So after I like moved out for college and stuff, and like I did occasionally see her since like I could for a little bit. It was pretty hard to like transition to like adulting and actually finding like an adult PCP. I will say though, I hope you're proud of me. A lot of friends now, like my female friends who like have never like had a pap smear things, I'm like, you should really go, and like encourage them to like get checked up, especially like as women with ovaries. I think you'd be proud.
You know, pap smears don't do ovaries, right?
Okay, I meant. Okay, that's not the point.
You could have just said as women. I don't know why you needed to specify women with ovaries.
Whatever.
Right. But thank you for keeping routine medical care cool in your community and in your circle of peers.
Thank you.
Right, like even just doing the bare minimum or just doing a little is certainly better than doing nothing at all. So I appreciate it. All right.
God, of course, man.
Let's start with Doctordle number 69.
Okay.
All right. Why don't you read this out?
A 57-year-old woman presents with abdominal uterine bleeding for 3 weeks.
It says abnormal uterine bleeding.
Oh, sorry, abnormal uterine bleeding. So I was in T for like 3 hours. My brain is not there.
Okay.
At one point, I dissociated so bad I thought I was gonna faint.
Are you good?
I'm okay.
Do we need to be Doctordoling you instead?
No, I'm good.
All right. Okay. So imagine, like a family member, like your mom, your aunt, whatever, calls you, right? And they've just been saying that they've been having uterine bleeding. They've noticed blood coming out of there for 3 weeks, way after menopause, but they don't know what's going on. It's probably, I don't know if it's painful or not, but, they're giving you these symptoms. Where would you start with, right? Like you tell them, go see a doctor. Oh, they can't get an appointment for like a week. So how would we want to approach this diagnostically? Like using the internet, what kinds of things would you start like Googling up?
I guess I could Google like what are symptoms? What could be causes? Sorry, what could cause abnormal uterine bleeding in a woman after menopause?
Yeah, do it.
Oh, you want like
I want to see what sort of things.
Oh wait, should I share my Google?
Yeah, like that's the whole
point. Can you hide it for just a second in case my IRL stuff is
like, you want me to hide the whole like
No,
window?
just hide your screen.
Okay, well, it's black now.
Yes, exactly. I just want to make sure that my Google does not have my IRL stuff, because that's what I'm afraid of. Hold on. I'll do one better. I'm just gonna open one in a private tab. Apologies.
Okay.
Apologies. You might have to reshare everything. I'm so sorry.
My apologies. All right, we got some diagnostics in chat. All right, stage 12 lung cancer. Okay.
Okay. Surely my information will not. Wait, I googled Google. Okay.
You, my mom.
Wait, my information will not show, right?
If you're
where I
in a
live and
private
stuff?
tab and you don't share your location data, they shouldn't be giving you like geolocated ads or show your location like local results or whatever.
I sure hope it doesn't. How is Bree not more scared about this?
I don't know. Does Bree really care about much in this world?
I don't know. Okay, let me Google possible causes of abnormal uterine bleeding in after menopause. What was that?
Am I good to stream?
Oh, yes. You can, yeah.
Okay. All right, so we looked at possible causes of abnormal uterine bleeding. We get the shitty AI Google thing that's trying to take over like etymologies and stuff.
Yes.
How many P's does Google have?
Ooh.
Wait, can you look up the thing that says how many P's does Google have?
Bro, oh my god.
And it's like Goople. The word Google has exactly 2 P's in it.
All right.
Yeah, this is what everything is coming to now.
Okay.
All right.
Anyways, postmenopausal bleeding, bleeding from your vagina after menopause isn't normal. Non-cancerous conditions. Oh. Wait. Oh, uterine cancer. Oh God. Vaginal atrophy. Hormone replacement.
Yeah, so
therapy.
we have a good starting place here, right? So we're on Cleveland Clinic, right? Cleveland Clinic is a reputable source. It's a reputable healthcare system. Now we have, abnormal uterine bleeding in a 57-year-old woman. For Doctordle's case, I mean, it can be any of these things, right? It could be vaginal atrophy, it could be polyps, it could be hyperplasia, it could be cancer, and all these things. So, I mean, just throw one at the wall and see what sticks, because you're only getting this one sentence so far.
Yes. Well, okay. I don't think it'd be hormone replacement therapy.
Unless like the fourth clue they give you is like she was recently started a hormone replacement therapy.
Okay, well, yeah. I guess maybe towards endometriosis type of things. So maybe endometrial hyperplasia.
Yeah, that's a good one too.
Oh wait, I have to type it in.
Yeah,
I forgot.
Oh. Oh.
Let's go.
Wait, you got it in one? Dude, have you ever gotten a Wordle in one before?
No, I start with horse.
It's never been horse?
Nope.
Wait, I'm actually impressed.
Thank you.
Yeah. So,
Thank you.
yeah, I mean, so abnormal uterine bleeding, you're worried about like 1, a problem with the uterus, or 2, a problem with the hormonal axis that's leading to that, right? A lot of women, postmenopausal women, get confused when it first happens and they're like, oh, my period came back, which, you know, is not necessarily a good thing if you are postmenopausal and you're lacking the normal LSH, FH feedback axis that happens when you're a lot younger and having monthly cycles. So she has no significant past medical history and she's never been pregnant. The ultrasound does show that she has a thickened endometrium. So the lining in the uterus that's there to shed every month
it's too thick.
or sustain a pregnancy in the case of a pregnancy, even though it's supposed to shed every month, now it's extremely thick. And because of that, it's vascularized, it's full of blood vessels, it's full of...
And that's why it's shedding on its own, even though she doesn't have periods anymore.
So obviously this part isn't supposed to happen, but in things where endometrial hyperplasia could be, conflated with other conditions, or you would see in a younger woman, right? Because they are going to be bleeding monthly as well. So are you bleeding in between when your normal period is? Are you having extremely heavy and painful periods, or heavy flow days, like a lot more than normal, like 5 heavy bleeding days in a row, and these sorts of things? So she's also receiving estrogen replacement therapy, so it could also have been the hormone therapy, and we could also talk about breakthrough bleeding as well. But yeah, you got pretty lucky. You solved it in one. The patient you solved it in
That's
one.
all skill, bro.
The patient is like, "Thank you, Dr. Hazumi. You're doing amazing work out here," and leaves you a 5-star review on Google.
Thank you, random citizen.
I don't know if, I mean, I probably would have said endometrial hyperplasia too. I don't know if you beat me, but I actually didn't say my diagnosis or what I thought it would be. So I guess we can say you beat me too.
Yeah, I'm chat's doctor.
Oh my god. All right.
Okay.
We can go on to 70.
A 40-year-old man presents with worsening fatigue and excessive sweating over the past year.
Cool.
So are you going to talk about your diagnosis, or do I go first?
Oh, okay. Wait, so
How are we supposed to do this?
I don't
You never
know
explained
because
it.
I didn't do it. I never did it with Bree. So
Oh, okay.
okay. Worsening fatigue, excessive sweating. I would say this could be a probably a adrenal problem, like
Oh.
maybe like hypercortisolism. He's 40. Yeah, sure. Let's say hypo. Let's say it's Addison's disease.
Do you want me to type
just
that?
no, that's just what I'm saying. You go for it.
Okay.
So yeah, your friend calls you saying, "Oh my God, Dr. Hazumi, what do I do?
Mm-hmm.
My uncle's brother's college roommate, dog walker's friend is saying that they've been having worsening fatigue and excessive sweating for the past year."
Past year is insane. Go check that out, bro.
A lot of people don't.
Oh, it's like my dad. Okay. Anyways, I guess I would say causes of excessive sweating and worsening fatigue.
I think WebMD has a tool where you can actually just do that. Where you can just like plug in symptoms and it tries to spit out whatever it can. Dazzy in the chat says, my guess is something with thyroid. Yeah, I usually, for thyroid, excessive sweating is definitely up there, but for hyperthyroid, but the worsening fatigue part is kind of throwing me off a little bit, because with hyperthyroid, you would expect somebody is like constantly, in on switch mode, right? So they're excessively sweating, but their heart rate is like 5,000. They're losing weight. They're getting really thin. They can't sleep because, they constantly palpitations. So that's why I was kind of thinking on a different like
hyperhidrosis. I don't think that's no. I don't think they have the right one. Okay. No.
Chat says lupus, of course.
No. Oh my god. Why is it only hyperhidrosis? No. No, he's not just sweating. Okay.
Lung cancer, Addison's,
malaria,
sleep apnea. My final guess is acromegaly. How do you get acromegaly?
Oh wait, but this is kind of like what you said, right? With the adrenal gland.
Oh, that's just what I said.
Oh, you said this one?
No, I mean like that's that like okay. So a pheo is a specific type of adrenal gland tumor that's producing a lot of like adrenaline. It's gonna like jack your blood pressure way up. It's going to be like the kind of thing where I said like why I didn't say thyroid. But anyway, you're not supposed to go off of what I said. You're supposed to use the internet to find your own, diagnosis and see it like if it lines up.
Okay. But you said it's not hyperthyroidism, but what about hypothyroidism?
What about hypothyroidism? What are the symptoms of hypothyroidism?
True.
I think I made a Twitter post about this one time.
Symptoms of hypothyroidism in men. Severe fatigue. Okay. Ooh, erectile dysfunction. Fun.
That's fun to you?
Wait, temperature sensitivity too? Should I guess that?
Sure. I mean, if you think worsening fatigue and excessive sweating lines up with what you looked up, you only have one sentence so far, right? So
yeah,
you don't have too much to go off of.
I might have to ask you what is the difference between these?
Right. So like one is like a replacement. So
a hip replacement?
No, like replacement of iodine. It causes a paradoxical like decrease in thyroid function. The other one is congenital hypothyroidism, which we used to call cretinism. But this is what you see in countries where people don't have enough iodine intake, and they have hypothyroidism because of a nutritional deficiency. This is why in the United States, if you notice, like all of our salt is iodized because people eat salt a lot in their cooking, and the American government decided to start putting iodine in salt so that we wouldn't have iodine deficiencies.
Oh.
But he's 40 years old. Maybe he stopped eating salt. This is something that you see in a lot of patients, like in the 21st century too. Like when pink Himalayan salt was becoming a thing, or people are trying to eat like fancy sea salts or whatever, they're not eating just like the generic Morton's iodized table salt, and they actually develop iodine deficiencies because they're trying to eat like fancier salts or salts that are better for you, but they actually end up developing a very basic deficiency that the government tried to correct in the 50s.
Yeah. Wait, so then is there... Oh, this one's iodine excess. There's iodine excess and iodine deficiency. What if he eats too much salt?
Well, then you have a problem with salt intake probably before you deal with an iodine intake problem.
So which one would I click?
Up to you. You're the doctor today.
Oh.
I'm just here to provide
sir.
context.
Okay, sir. I'm going to say you have congenital hypothyroidism. No. He was recently... Oh, wait. Oh. Interesting. He was recently diagnosed with diabetes mellitus after an elevated hemoglobin A1C was noted. Interesting.
Okay. I feel like somebody in the chat ended up getting this, but not for
I'm not looking at chat.
For the reasons that they should have.
I'm not looking at chat.
Yeah. Okay. So we're thinking diabetes.
Diagnosed. Diabetes adjacent. Wait, but if he already has diabetes, then wouldn't it just be wouldn't it just be diabetes at that point?
I mean, I don't think diabetes. So let's say recently diagnosed with diabetes, he's been having fatigue and sweating over the past year.
Oh, okay. Causing sweating and fatigue. Hypoglycemia. Or diabetic neuropathy. Oh my God. So, I mean, I feel like having low blood sugar and then also being diabetic could definitely be like a thing.
Yeah, those two things are related.
I'm gonna try it.
But how do we synthesize that with the first part?
Well, because wouldn't having low blood sugar cause a lot of like faintness, fatigue? Wouldn't that cause that? My mom has low blood sugar.
Yeah, I mean it could, but so the thing with diabetes is that people are usually going to have high blood sugars, right? So how diabetes works is that they are usually, let's just assume it's type 2. That they're having a insulin resistance problem because, you know, they're 40, they're a guy, they're American, right? They probably eat a lot of simple sugars, and they've kind of burned through their supply that their body is resistant to the insulin signaling. So in this case, that what usually happens in people in middle age who develop diabetes, it's they have the insulin, they are producing the insulin, but their body isn't responding to the insulin, which normally shifts the sugar inside the cells. In this case, the sugar is sitting there in the bloodstream. That's what high blood sugar means.
So then why does it say that it causes low blood sugar?
That's what the internet's telling you.
What the hell?
Diabetes can cause low blood sugar. You know, overdosing on insulin, you know, more units than you're supposed to have also can cause low blood sugar. You can have, you know, postprandial hypoglycemia, which is when you eat a lot of simple carbs and your body shoots out a lot of insulin to deal with that. And then you also go hypoglycemic right after you eat. This is why, like, you want to eat like high glycemic index foods, like things that slowly release the sugars and the carbs over time. So things like oats and stuff. But we're getting in the weeds of like the differential. Basically, it's asking you, how do you correlate fatigue and sweating with diabetes?
Yeah. Well, someone said, or the internet said the autonomic neuropathy, but then it said that it leads to hyperhidrosis. So this isn't sweating and fatigue in the sense that he's tired. It's just that he's wet.
What? Yeah, no, that actually, you know, I would believe that, right? So diabetes, because your body is resistant to insulin after having so much sugar go through your system over the years, you have a lot of free glucose in the bloodstream instead. And that free sugar that's not supposed to be there, the free sugar that's usually supposed to go inside the cells, this free sugar can damage your nerves, right? And damage different nervous systems. That's what diabetic neuropathy is, right? It's a pathology of the nerve system due to diabetes. And autonomic neuropathy is specifically due to the autonomic nervous system, which regulates, you know, all the functions in your body that you usually don't think about.
And hydrosis cause fatigue. Okay. I'm doing it.
Okay.
Central nervous dysfunction of sweat secretion. Blah 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 blah. Blah. I'm trying to find. Wait, hold on. Fatigue. What? There's no match. Literally trying to find. No, I'm trying. I'm trying to see if it causes fatigue. Wait,
there's a YouTube chat that says you're very professional.
Aw,
unlike the diva from before. The contrast is funny.
Well, actually, that's why Saiken told me that he chose both of us, because he was like, I know that you'll
I knew you would actually try and like try to take it seriously and try to actually like do the stream as intended. It's just that you had raid first, so I had to bring on Bree first.
I think it's a nice palate cleanser from the funny whimsy. Okay.
Someone says we're losing the forest or the trees. How many tabs do we have open now? 1, 2, 3, 4, 5, 6.
Wait, what does that have to do with anything?
Like now we're getting in the weeds. Like we're really trying to look up things now, right? And like people get lost like this, right? Like you end up going on like a 10-15 minute tangent, and then you start looking up symptoms, and you're like, cancer.
Wait, how do you diabetic? Hello? Wait, what did I say? Diabetic, autonomic. I don't even think that's here.
I don't think it's not. That's a pretty diabetic neuropathy maybe could be one, but that mostly like refers to like the physical symptoms of like pain.
Oh, neuropathic, no, foot ulcer. Well, it doesn't look like anything's even there. Weird. Okay. Okay, wait. 40-year-old man presenting worsening fatigue and excessive sweating over the past year, recently diagnosed with diabetes. Okay, maybe something with his hemoglobin instead. Can elevated hemoglobin, A1C, can elevated hemoglobin cause fatigue?
So a hemoglobin and a hemoglobin A1C are two different things.
Oh.
So you want to make sure that the search engine knows that, or knows what you're trying to ask for. So hemoglobin is basically a measure of how much like red blood cells are in your system, right? If you have low hemoglobin, that's what we call anemia, right? When you don't have enough hemoglobin concentration in your body, hemoglobin is basically the main function of red blood cells to carry oxygen throughout the body, from recharging at the lungs, shooting through your blood vessels and going to all of your tissues and your fingers and your legs and your toes, and making sure that oxygen gets delivered to every part of your body, 1,000 times a second.
Okay.
Hemoglobin is the actual protein that exists in the red blood cells. Hemoglobin A1C is a specific measure of your diabetic status, really. A1C refers to the fact that the hemoglobin is being tagged by the glucose molecules in your blood. It's referring to glycosylation, which is, like I was saying, you have a lot of free sugars existing in your bloodstream instead of being inside your cells because your body isn't responding to insulin that normally shoves the blood sugars into your cells. When the sugars exist in your bloodstream instead, some of them can tag onto your hemoglobin, and when that happens, it will glycosylate it and create something called an A1C. So that basically is reported in a percentage. So somebody said, I think my record A1C is 13, right? We diagnosed diabetes at an A1C of 7. So that means out of every 100 hemoglobin molecules, 7 of them are going to be glycosylated. The other person saying 13, out of every 100, 13% of them are glycosylated. So it's usually like a severity of their diabetes status.
What if it's just lupus?
What if it's just lupus? JFMD says it's actually 6.5. All right, well, this is why you're the PCP and I'm the hospitalist.
Diabetes at the same time. You can. Wait.
I'm getting PCP checked right now.
Wait. Flares. Wait. Pause. No way it actually is that. No way.
I played Doctordle like 3 times on stream now, and I have never gotten lupus as an answer. Just saying.
You never know.
There has to be one, right? Like, one of the Doctordoles has to be lupus, right?
Is it this?
Systemic lupus erythematosus is the full name for lupus, yes. I do not think this is lupus.
Damn it, dude, that would have been so funny. That would have been so funny.
Statistically, if we assume the game goes forever, lupus will eventually happen.
Wait, joint discomfort and difficulty?
Okay, that person in chat was definitely right then. Yeah. It is what I think it is. Yeah.
Okay, wait. Okay. Wait. Okay, joint discomfort getting into a shoe. Oh my god, wait. My grandma had something similar to that. Not gout, but like something was causing her feet to get like her feet would be like enlarged.
So difficulty fitting into shoes is a pretty common symptom of things like edema, which can be a problem that we see in like heart failure. And this will probably be one of the first manifestations. Like patients feel like their legs are really tight or their feet are really swollen with fluid, and they can't fit into their shoes normally. Yeah. But they're also talking about joint discomfort here too. So probably not a new like cardiac condition happening over the past year, especially with the fatigue and the sweating. So this is kind of pointing in really one direction. Let's see if we can get it from the search engine too.
Okay. It still says diabetic neuropathy because that was the one that it said. This one says peripheral artery disease. Because I don't think it'd be Charcot foot specifically because it's just talking about specifically feet.
Yeah, it's called Charcot foot, not Charcot feet.
Okay, my bad. Anyways, I meant in the sense that it's like some whatever. See, I thought it was gonna be something with the kidneys.
Why kidneys?
Oh wait, yeah, wait. This part too, where because the body cannot like get rid of its waste anymore. So what if because of that he's excessively sweating to try and get rid of the waste? Is that a possibility? Since he can't flush it out by peeing, like would he just start flushing it out through like just his sweat glands?
No, I think you're on a completely
different
wrong tangent.
Cooking. I thought it was cooking.
You were cooking. You're right. Fluid balance, fluid dynamics. Even a lot of doctors don't understand how to treat fluid balance correctly in the hospital.
I thought I was cooking, man.
Somebody asked me what I think. It's the thing. Somebody said it earlier. It's a thing that causes like a patient to be like, my hat doesn't fit anymore.
Big ass head.
That's what I think it is.
Would that not be something with like fluid retention then? Because
The fluid retention is one of the things that can cause somebody saying my shoes don't fit anymore.
yeah. Wait, but hat doesn't fit on their head. Brain tumor.
You're getting warmer? Yeah?
Really? Causes of swollen limbs and joint discomfort.
That is a very broad thing right there.
Whatever, man. God. Mayo
Somebody
Clinic,
says
please don't fail me.
inflation.
Inflation. Oh my god, it's peripheral artery disease.
Peripheral artery disease is just when you get cholesterol and fats like clogging up your arteries.
Oh my god, dude, I'm okay. Oh no, this is a different one. I don't even know where I am anymore. Hello?
We're at
Where am I?
9 tabs.
Okay. A lot of it's saying Charcot joint. Osteoporosis? No.
Bon appetit.
No, that probably would not be it.
What if it's a dementia patient dissociating their medical history and nothing they say is true?
Dude, that'd be insane. Osteoarthritis? I don't think that would be it, would it? Because does that have to do with swollen feet?
I mean, it explains the joint pain, but
not the
does
swelling.
not explain like the diabetes, the sweating, the fatigue.
Okay, wait. Causes of joint pain, foot swelling, sweating, and fatigue in a patient with diabetes. Dude, everything says this! Everything says diabetic neuropathy. But it's not even an answer, is it? Dude, now low-key, now it might be diabetic foot ulcer at this point.
Yeah, and then the 6th one is going to be like, patient complains of a gigantic ulcer on the bottom of his foot. Yeah, I mean, if you need more clues. Yeah. This one is what really...
Dude.
Yeah, like this is like the gold standard symptom that people would like instantly diagnose this as.
Oh my god, I'm losing my mind right now. Grey's Anatomy, help me. Shit. Okay. Coarse facial features, prominent brow, and enlarged nose. Are they talking about like an ethnicity?
No.
Oh, then what does that mean?
You have the internet.
Okay. I'm gonna copy and paste this. Coarse facial features.
What does it say? It's too small.
Acromegaly. What? Dude. Acromegaly. Okay. Dude, what? Oh my god, this guy's got so much stuff going on. Okay. Acromegaly. Diabetic patient with sweating, fatigue, joint pain, foot swelling, excess growth hormone. Wait, this is all of that. Yeah, but it's just his diabetes. Wait. Dude, I'm just gonna say acromegaly.
Nice.
Let's go! Oh
Yeah,
my god.
Somebody said it in chat from like the first one, and I was like, "What the fuck?" But I was getting towards it on the second one. But yeah,
Dang.
the picture was painted a little weird, but they did introduce the diabetes as a way to link all of the 3 symptoms in the first
Dude,
place.
I was so confused. But then this time I saw all this. I was like, there's no way it's not this.
Yeah,
There is no way it's not this.
So acromegaly is a condition where your body secretes a lot of growth hormone, but you're already a grown-ass man at 40, right? You're not playing League of Legends anymore. You're not...
Okay.
You're unk, okay? So when this happens, your body is basically already done growing. Like you're not going to get any taller, you're not going to get any bigger. But because of all of this growth hormone is being secreted by the pituitary, you're basically growing inside of your skeleton, which is already fixed. So that's why they have joint pains. That's why they feel like their shoes don't fit. That's why they feel like their hats don't fit. Coarse brow and these features. If you look up acromegaly face, like there's a very specific like facial pattern that happens.
Is this just like puberty too?
Basically, right? Like, so it is the growth hormone that's being secreted that's the same in puberty, but it's happening when they're already like grown adults. And that's like basically creating them to grow inside of, a fixed skeleton. So if you look at like the acromegaly face, so like acromegaly jaw, it is a very like typical pattern that these patients have. Though specifically, what you learn in med school is that you never actually test the growth hormone itself. You look for insulin-like growth factor 1 because the IGF-1 that's actually created by the liver responding to growth factor is actually what causes their symptoms. And you'll see that they'll develop, diabetes because like the growth hormone is constantly burning fat, right? They're constantly like going through puberty in that growing sense, but they're already fully grown.
So the diabetes is connected because the acromegaly causes diabetes?
Yes. So it is specifically the pituitary, that is a gland in your brain that has like a cancer or something or a growth, and it is inappropriately secreting growth hormone. So when you said brain tumor, you were actually kind of on the right track.
Oh my God. That's crazy.
Yeah. So for this, we can use, we can treat it with like medical therapy or radiation or like growth hormone inhibition. But I think ultimately like the first line treatment for a macroadenoma like that is just, a transsphenoidal surgery. They just go through your nose and they resect the tumor through your nose.
Yeah.
Yeah. Good job. Yeah. I mean, we were able to figure it out in 4, I think.
Yeah, 4.
That's pretty good.
I'm proud.
But yeah, somebody said his shoes sadly will never fit anymore. Yeah, so we're not gonna, you're not gonna reverse the effects of all the growths like in the face and in the body, but obviously you're going to prevent it from getting worse to the point where you're gonna die, right?
Oh my God. Benjamin Button.
Well, it's actually Andre the Giant, but yeah.
Oh. Okay. A 30-year-old man presents with intermittent fever, headache, and daytime sleepiness. Dude, that's just me. Obtaining a full history is difficult.
You're a 30-year-old man.
Due to confusion and somnolescence. The fuck is this?
Whoa. Okay.
Somnolence. What the hell's that?
What? Okay,
hello?
so he's got fever, he's got daytime sleepiness, and you can't even talk to him to get his medical history because he's like super disoriented and he's like falling asleep in the middle of the interview. That is.
So does he just have narcolepsy?
Narcolepsy wouldn't come in with fever, so for me this is pointing towards infection, pointing towards like a very specific type of infection.
Lupus.
Lupus is not an infection.
Damn. Okay. Do you have your answer? Do you know what it is?
I have my answer. It is named after a continent. Actually, that was probably too easy for you.
Asia. I don't know. Okay. Intermittent fever, headache, and daytime sleepiness. Wait, what did it say? Fever. Oh, headache. Daytime sleepiness. And
somebody said Asiatic lupus, European lupus, Asian lupus, African lupus, Antarctic lupus, Australian lupus.
Okay, well, you said it's a continent?
Yeah, that was too easy. I should have said
Malaria?
something else.
Wait, I'm not gonna. Hold on. I'm gonna do this the other way.
What's the other way?
Infections named after continents.
Oh my god.
Oh, kissing bugs. What the hell?
That's Chagas. That's named after a continent? Oh, it's American trypanosomiasis.
Okay, time to look up all of these. This is how we do it, baby. Okay, Chagas disease. What the hell? Okay.
Chat said I threw. I gave you too big of a hint.
You did.
Well, I'm trying to convey it. All right, you know, I should just type it in the chat because you're not reading the chat, right?
No, I'm not.
Yeah, I should just do that instead.
Yeah. Okay, wait.
I feel like if you went back to your Google results and then you just read all of them, you would probably get it.
Like these?
Yeah.
Okay, wait, hold on. Oh, okay, wait, never mind. It's not that. Vascular disease. Wait, but they're not telling me.
Huh?
Doesn't tell me at all.
The one that you're moused over right now.
This one?
Read it.
Wait, what? Oh!
Go next.
I didn't read the parentheses, bro.
Why didn't you read the parentheses?
I'm dead.
The words are still there.
Wait, is it just sleeping sick? Oh, there it is. Guys, chat. I'm so good.
The only thing I know about this is it's caused by the tsetse fly. I don't. It's like TSE.
That's what it said. Yeah, it said.
Yeah, tsetse fly.
It said. Wait.
And you get fevers,
fevers
and somnolence and confusion. I mean, that's basically literally like what the first lines was. Tsetse fly. Is that a parasite? So it answered one of chat's questions before. Yeah, it is the, what is it? Trypanosoma. I don't fucking know what the species name is, but yeah. Again, one of those ones that I never encounter, but like my followers do or something. Like, I think I told you this. Like, I have a lot of Filipino fans or med students, and they were just talking about like, oh yeah, I had dengue. Like, oh yeah, I had chikungunya, and I'm like, oh, like we never treat these in America, but it's just like very common, you know, and endemic to like certain regions in the world. So it's like I would freak out if I ever had a patient with dengue, but like in Southeast Asia, it's like probably something they see like every day.
Interesting. Okay.
All right, go next. I'm gonna type in the chat.
65-year-old man presents with burning, aching pain in his right arm and leg. Heart attack. I don't know.
Gotta type in both chats.
65 presents burning. Heartburn.
Burning, aching pain in the right arm and leg.
Burning, aching pain in the right arm and leg in a 65-year-old man. Spinal nerve compression. Oh wait, why am I reading the Google AI? I just realized.
because people read the Google AI. I put in my guess and JFMD said, what kind? Oh, man.
Okay.
Whoa, someone
Oh,
said
what the?
berry. Whoa, spinal meningitis. Whoa. He's just got pain in his arm and leg. Oh.
Rheumatoid arthritis, mayhap? Okay, what does the Google AI say? Because the Google AI did help me before, actually.
It helped you and then you didn't even read it.
Yeah. Peripheral artery disease.
Yeah, I put in a new guess in the chat.
So that's your second guess.
Well, technically still my first guess because I wasn't specific enough for the first one, but I think this is what it is.
Okay, wait.
So I will say, I guess the anchoring point here is the aching pain in the right arm and leg.
Yeah.
Like pain on one side of the body, and very specifically the right arm and leg. Where are you getting at? Narrate your experience. He was lying
right,
on the side
sorry.
of a field of stinging nettle. Yeah.
Yes. Okay. So apparently people are thinking it is a neurological issue.
Yep. You're getting warm.
Compressed spine? No, but why would that cause a burning sensation?
Because it's painful.
Okay, I guess. Radiculopathy. Central neurological conditions.
Could be a radiculopathy.
Oh, okay, well, when you said could be, now I feel like it's not. Okay, that's different.
I'm just saying all of these things are valid, right? So burning, aching pain, right? This is a kind of neurologic response, right? It's not like he's actually burned, right? It's not like he actually has any trauma, I assume. But he's coming in with this sort of like neuropathic pain where his nerves in his arm and his leg are firing, even though that there's no, known insult or damage. But for some reason, something is going on inside of him that's causing him to have pain in his arm and leg.
Mm-hmm.
Someone said blood vessels.
Now, okay.
Ticks.
Maybe I'll put whatever it is.
Radiculopathy.
Maybe cervical radiculopathy. Hold on. Let me see what it says. What? Wait, did I spell it wrong? No, it's not even there.
No,
What?
It's not even there. Oh.
What the hell? Oh man. Okay. There goes my only answer. Wait, spinal stenosis. Oh no. That's the cause.
These are just Harry Potter spells. Ridiculousness.
Wait, neuropathy is not there, right? Neuropathy. Oh no, it goes back to the foot ulcer. Okay. Wait, what did I say? Wait, radial neuropathy? Saturday night palsy? What the fuck is that? Saturday
Night palsy. It's a thing. So if like you drink and you pass out on your arm.
Oh.
It has a name. That one's pretty good. There's another one. There's a paresthesia neuralgica. That's Calvin Klein syndrome. That's a fun one.
That's crazy. Okay. Oh my god, Hara. Okay, hold on. Okay, aching pain in the okay. Well, it's not these two. Peripheral artery. No. but this is particularly in the legs. It is supposed to be arm and legs, and only the right side.
Mm-hmm.
Can't
so
be that.
That's what the chat is saying, right? It's a weird distribution.
Yeah. Okay.
So if you had, peripheral artery disease, if you had high cholesterol or something, right? Like, why would it only be on the right side of your body?
Yeah. Is he having a stroke?
Could be.
Right side of body, burning sensation and pain.
Chad wants to know about Calvin-Klein syndrome. So it's meralgia paresthetica, right? Yeah. So this is when you have a nerve in your lumbar plexus called the LCF, lateral femoral cutaneous nerve, and it is a sensory only nerve that supplies your like anterior lateral thigh. But because where it passes near your inguinal ligament, this nerve can get compressed at the waistline. So in like the 90s, when Calvin Klein was going super hard with like skinny jeans and like tight underwear, a lot of people would start having this, meralgia paresthetica. So that's why it was called Calvin Klein syndrome in America, because it was literally just like the fashion that was causing people to develop these symptoms.
Okay, I thought it was going to be sciatica. Because my old roommate had that. Oh, wait, I spelled it wrong. That's why. Fuck! Dude. This is stressing me out. Okay, wait. Chronic pain on right side of body. Okay.
Damn. Thanks for stopping by.
Yeah, thanks for stopping by. While I like struggle. Okay. Okay.
None of this is in my emergency medicine syllabus, therefore it's heathen witchcraft. That's how I feel about emergency medicine as an internal medicine doctor. I mean, if you gotta get more symptoms, to really narrow it down, and you can just skip one.
I don't want to skip one. I'm gonna put shingles.
Okay.
Okay. Physical exam reveals hypersensitivity to light, touch, and temperature in the right extreme. Okay, so it's still on the right side.
Hypersensitivity to light, touch, and temperature. Med students in the chat, which spinal tract am I worried about? Ooh, which spinal tract is responsible for those symptoms?
Wait.
This isn't related to the answer of the question. It's just like an anatomy, physiology question.
Yes. Okay, one says allodynia, which I tried to find. I tried to find allodynia here, and I didn't see it. So.
Yeah, it's a type of neuropathy, but you are on the right track in that sense.
Okay. Hyperesthesia. Extreme sensitivity and sense of touch. Wait. Yeah. Okay, wait. Hold on, I need to copy and paste this. Can happen on one side of the body.
Yeah, you're pretty warm.
Okay.
You're not like jam drawing Venat warm, but you're like
okay.
pretty decently warm,
Okay. Wait, hemisensory syndrome?
Somebody says, "Is it overreactors disease?" Well, that kind of is like what hyperalgesia is or allodynia is, right? So it's kind of just like thinking like what can cause these sorts of things, right? The guy has hypersensitivity, high pain without like a known cause, right? It's out of proportion to, you know, his physical exam. So why is this happening?
Okay, wait. Hemisensory syndrome. Symptoms. Okay. Numbing, tingling, pain, or loss of sensation. Wait, okay. Wait, it's not even there. Are you serious? No way. Every guest I have is not here. Okay.
I mean, yeah, it is like a game, right? It's not gonna have like every single one.
Hyper S. What? What? Oh my god. Oh, I'm stressed.
What does the article say? How does hyperesthesia happen?
Brain or spinal cord, nerve roots, cranial nerves, neuralgia. Okay, occipital neuralgia, trigeminal. Oh wow. That was not right. Okay,
Somebody says
See,
this shows how stressed people can be while searching their conditions on Google.
Exactly.
Yeah,
Exactly.
it's
This is
real,
literally
like
why
this-
I don't.
yeah.
This is why I don't do my symptoms or anything like that. Instead, I message my doctor friends about it
Pause.
and make them do it. Okay, occipital neuralgia. Okay, no, that wouldn't be occipital. Maybe it is a neuralgia. I know what neuralgia means. It's pain of the nerve.
Mm-hmm. Right, because we're saying it's not like he slept in a field of poison ivy on his right side, right?
Yeah.
It's not like he had a giant like crush injury on his right side, but he's like hypersensitive, so he's got hyperesthesia, he's got allodynia, and all these things. There is a name for a condition that can cause this, and more specifically with the distribution of his symptoms. That one syndrome, I think, is a lot more like lighting up to me. That's how I guessed it from.
Oh no, but trigeminal.
Trigeminal neuralgia is
This is
really
in
in the
face.
distribution of the trigeminal nerve in the face.
Okay.
Mostly that'll be like a gust of wind, or like somebody just like
Oh my god, this is.
touching your face can cause like a lot of pain in there.
Okay. Dude. I'm so stressed out right now. I'm actually so
sorry.
stressed out. Okay. Can I do this? Shingles. Fuck, are you serious?
Post-herpetic neuralgia. Ooh.
Okay, that's the okay. It only has trigeminal neuralgia too. Oh my god, I'm so stressed out right now. Yeah, my cortisol is spiking. I have to read chat at that one moment. My cortisol is spiking, dude. Oh my god. Okay, wait.
You want to put down my guess?
No. No. I'm competitive. Okay. Okay, it still says hyperesthesia. Okay, wait. Complex regional pain symptoms or syndrome. Is that a thing? Chronic pain conditionally typically triggered in an injury arm or leg. Oh, wait. This is. Hold on. Complex.
Let her cook.
Oh my god. Dude,
CRPS is a pretty good one, but it wouldn't be in this distribution. It would. Oh my god.
that was me choking myself out.
Okay.
Okay, hold on. Wait. movement or emotional stress. Dude, that's me
So I
right
think
now.
this is pretty.
I am under
pretty specific
duress.
for what it is.
I am under duress. Motion. Wait, what? That worsens with emotional.
He's stressed.
Stress.
She is too.
It's literally giving me the same fucking shit. Okay.
Maybe it's because the AI is poopy.
But this one says hyperesthesia, and I keep typing that in. What? And this one says
You are completely on the right track. I think you just can't find the name. That's the thing that's causing it.
Yeah, okay, because the CRPS it literally says everything. Literally, severe hypersensitivity worsens during periods of high stress. Are you freaking serious right now? Are you freaking serious right now, man? What the heck? Okay, wait. Okay, hold on.
Med student levels of crying.
Diagnosis similar to CRPS. No, not the differential. No, I want. Do I want the differential? Hold on.
What is the differential?
I forgot. Fuck.
So a differential diagnosis is when doctors throw a bunch of diagnoses at the board to try to see, what lines up the most.
Oh, like
right?
in house.
So, or like a normal doctor's job.
Too.
Right. It's not enough just to say like what this one thing is and just say what the first thing on the top of your head is, right? We always put down like 4 or 5 things and try to make sure that we ruled out what it isn't, which sometimes is more important than knowing what it is.
Okay. Post-traumatic neuralgia. Okay, but neuralgia isn't in it, so it can't be that. Okay. There's a lot of words. Okay. Lyme disease? No way, it's Lyme disease.
Did you sneeze? Somebody in chat says bless you, even though you're not looking at chat, so I will.
Oh, you didn't hear me?
Ocarina Gaming said bless you.
This is like 5 minutes ago.
Oh. She's going to pop a vein.
Bilateral is bilateral. Bilateral is 2 sides, right?
Right. It's not bilateral.
So it wouldn't be that. Yeah.
It's unilateral. Which is the interesting part.
Wait. Okay. Unilateral CRPS.
Which is funny because unilateral and CRPS don't really make sense because it's not regional at that point.
Oh.
It's not regional on the leg. It's regional on the arm and the leg.
Dude, I'm stressed.
do you FF? Do you give?
No, I don't want to.
It's okay if you can't find the answer. You're in like the right area. I think it's just a combination of Doctordle not having the word that you're thinking of, and you can't like connect those 2 words together. Maybe it's a good idea to decompress after solving this. I can do the next Doctordle myself. How about that? I'll save you from one.
Oh my god! I'm just going. I'm leaving the area.
Just put it down. It's okay.
I don't want to. Okay. All right. Fine.
All right. Fine. So I think this is post-stroke pain syndrome.
Are you fucking? I fucking said stroke.
But it's a specific type of syndrome that develops with like the distribution of the stroke area.
Is this
central? Is there no post-stroke pain syndrome? Yeah, that one.
I literally said a stroke in the beginning.
Yeah, and like stroke and hyperesthesia and allodynia, right? Like it's
my god,
so
man.
shit. Yeah, so it even said he had a
I
left.
literally said he probably had a stroke. That's the first thing I said, man. You know what? I count that as a win.
Yeah.
I count that as a win.
So basically, the Pent got this in the chat, obviously because he's a neurologist, right? But when you think about stroke symptoms, or specifically like the kind of distribution of this guy's symptoms, everything in the brain is wired into the body. As long as you trace the path of the nerves from the brain, you are able to figure out what part of the body is affected. Which means if you know what part of the body is affected, you can trace what part of the brain is affected. This is where the meme comes from for, oh, you can't just, put somebody in the CT scanner. You need to localize the symptoms and figure out what part of the brain is affected by what spinal tract is affected. And then the emergency doctor is like, haha, CT, donut of truth goes brrr. So it is very easy to shove somebody into the scanner and figure out what's wrong with them. But right arm, right leg is a very uncommon presentation. This is a very high up stroke in the brain. So this is a stroke that is recurring pain due to like damage to the sensory system. And it's also, it's brought on by triggers, right? So when he's stressed or, oh man, is this a PEDS one?
Yeah.
Do you want to do this instead?
Oh my god. Okay, sure.
Okay, I'll do it. I'll do it.
I'll do it. No, it's okay. No, I'll do it.
Okay, no, I'll do this one. You'll do the next one, and I can let you go. I will free you. You were freed after the next
one. Let me do this one, please.
Okay.
Please. Okay. Hold on.
A 7-year-old boy is brought to the clinic by his mother for evaluation of mild fever, malaise, and decreased appetite over the past few days.
Yes.
All right, so you are a concerned mom. You have a 7-year-old kid at home.
Please help my son.
And now you're just frantically Googling symptoms.
Okay, I need to help my sonny. My 7-year-old child has mild fever, malaise, and
non-specific.
Decreased appetite over the last few days.
Oh, somebody guessed exactly what I guessed.
Okay. Yo, what the fuck? Okay. No, I'm not. Please. Hello? Wait. Causes of a 7-year-old. Okay. Gastroenteritis? No way.
Why not? Like I said, this is pretty non-specific symptoms. Like a lot of different things can cause this. Malaise is just like tiredness. Like you don't want to get a mild fever, right? So it's not like an acute like burning up sort of fever, but maybe they're just like 100.8 or something, right? Decreased appetite over a few days, right? Gastroenteritis is a good one.
I guess I could do gastroenteritis.
Personally, I said flu, just because, I don't know.
Oh, norovirus. I don't know, but norovirus, I feel like they'd be like puking like crazy.
Pooping like crazy.
What is rotavirus?
It's another pooping like crazy.
Oh, okay. Okay, what about Clostridium, whatever it is?
C. diff? That's the one that people get from like...
C. diff.
Yeah, that's C. diff. Wait, are we back? Do you guys hear me? Oh wait, you guys can hear me. Oh wow. Okay, hang on. I think it's just the internet then. Cause like I use VTube Studio, like, and I pair it with my phone, so they're both using the internet. I think I just need to restart it then. Hey you're finally awake. Yeah, it came back, but my internet took a while to reboot, but I didn't actually think it was going to reboot like, oh, I'm moving now. Okay. Okay, I'm back on this end. Does my stream preview But I work? Didn't actually think. Oh, okay. Wait, we're back. All right. Let's see. What do we do here? My chat isn't working, but that's probably fine. Hey guys. Thanks for joining. We love a successful rehab. Chat and visuals got nuked. Yeah, I don't know what's going on there. Cuz everything should be connected, but it's just I don't want to restart it because I don't want to restart it because then I would have to close OBS and I would have to start a new like YouTube waiting room and stuff. So that's okay. I'm still reading your guys' chat here. I don't know. I told Hazumi it was fine and she could go. So he won't let me do the last one. I mean, do you want to come back? All right. How do I get my chat? Can we not go to the PEDS case? It was the PEDS case that nuked your internet. Oh my god. Okay. I will call you back then. Hello?
Hello. You're finally awake.
I'm back.
You're finally awake.
Yeah. I took a long nap.
Good morning. I was gonna say that if you exit OBS, the only thing that you'd have to restart is your Twitch stream, which kind of just did anyway.
Yeah, I already restarted my Twitch stream.
Yeah, as long as your YouTube is actually, there's a thing that, okay, never mind. This is way too much. This is way too complicated for someone that streams like twice a month.
This is way too complicated for someone like you.
Oh. No. Like YouTube in the back end, if you don't hit end stream, it won't stop the stream. You won't have to make a new like waiting room.
Oh, so I never hit end stream because my OBS stopped on its own.
Yes.
Oh, so on YouTube this is one concurrent 3-hour stream, yes. But on Twitch it's split up into 2.
Yeah, because Twitch is poo-poo.
Poo-poo. All right. Do you want to go back and share your screen then?
Oh yes. Let me do that.
Everyone was waiting for me. Thank you to everybody who stuck it out.
That's so sweet.
Yeah, they didn't report any outages. Like there weren't any outages on the outage map. So I think maybe if it's just like one like power line that went down, like, you know, if somebody like crashes into a pole or something and it just like knocks out one block. But yeah, it came back pretty quickly.
Pretty fast, that's the case.
I was lurking and I thought you ended stream. Yeah, we were in the middle of solving the diagnosis of this 7-year-old child's, and then it died.
Yeah, I like couldn't hear you anymore. I was like, hello?
Hello?
Did I say something wrong? But
Okay.
I think we were talking about how I was going to. I was saying that it might be norovirus, like gastroenteritis, but then I was saying, but I felt like if it's norovirus, then the fever would probably be a lot worse. Is that true?
I don't think he would even have a fever at all.
Oh. Well, say less then. Causes of a child having viral upper respiratory infections. Okay, I'll look up viral upper respiratory. Wait, but why would it be respiratory? If it's fever, malaise, and a decreased appetite.
I thought it was flu. That's a respiratory virus. Because it's low grade fever and malaise. Just like anything can cause that.
Well, that's why I was like, oh, it's probably just like a cold. A child.
A child.
A child. Oh my god, that was like a breather, and now I'm like stressed all over again.
Oh, I'm sorry.
No, it's okay. Why are you sorry?
Probably tweet that I'm back live.
Oh yeah. Let's see. Mild bacterial infections in children. Strep throat, ear infections, impetigo, pink eye. Okay, it's not those two. Loss of appetite, mild fever, and malaise. I feel like is not due to an ear infection. Oh, common childhood. Hello? Common childhood bacterial infections. Oh god. Oh my god. There's a bibliography. Oh Jesus Christ. Wait, what?
Oh, this is like a PubMed article. What
Yeah,
the heck? How did you get here?
I don't know. Where am I?
Acute respiratory virus. Okay. Is it report card syndrome?
Is that a thing?
No.
Oh. Okay.
Is that a thing you would do to not show your parents your report card?
No, I did pretty good in school up until like high school. then I kind of went down a little bit. Sickle cell disease. Oh my god. Huh. Okay, wait. I think I'm going far from the prompt. It could be anything, dude. Mild fever, malaise, and wait, did it say fatigue? No. And then decreased appetite in child.
How do I reset my chat box?
Click on the source and do clear cache and try that.
Clear cache. Refresh cache of current page. Test. Oh, okay. The chat is back. Test.
You're welcome, sir.
It's not back on YouTube, but it's good enough. Oh no, it is. It is back on YouTube.
You're welcome, sir.
Thank you.
Huh. This is so weird because it's not like giving me possible diagnoses. It's just telling me to feed my child and make them hydrated.
I mean, I don't think there's anything wrong with that, right? Maybe you don't even know what the like I said, this can literally be anything, even something as random or broad as like flu or like just any sort of
influenza.
Like, yeah, why not? I don't know what this is. I said flu when I did my guess.
A new rash. Okay.
Oh, okay. I'm guessing.
Causes of.
I think this rash will have a specific name. Someone says he ate a Lego.
chicken pox. I was low-key thinking chicken pox, but I don't think it's that. What's this high fever? Wait. Oh my god, wait, it is saying chicken pox. Hello? No way.
Warning, sensitive content.
Slap cheek disease? Oh my god. Okay. Scarlet fever? Hello?
Yeah, scarlet fever. It's a thing.
Oh. Okay, wait. Okay, wait. Causes of fever, malaise, loss of appetite, and a rash in a child. This one keeps saying... Wow. Typical... Rosola? Our Mayo Clinic. Oh,
That's,
roseola.
Herpes 6? Human herpes virus 6?
Oh my god. Starts with a high fever. Okay, okay. Oh, after the fever goes away, a rash often appears. Decrease. Okay, hold on. I'm gonna try that. Are you fucking serious?
The fever's still there. It's not waxing and waning.
Okay. I just thought it was waning because it said it's improved briefly. Wait. No way it's chicken pox. No way it's chicken pox. Okay. The rash is bright red and covers his cheeks, but the skin around his mouth is pale.
It is what I said it was.
I need to get it right. I need to get it right. Okay, wait. Okay. Rash in child that covers cheeks, but mouth is pale. Fifth disease? It is scarlet fever? No way. Wait, oh my god. When I said slap cheek, bro, I was laughing at that, and it probably is that. No way. No way. Wait, it's not even there. Hold up. Oh wait, parvovirus. Dude, no way. Oh my god,
yep.
I was literally laughing at that, bro.
Yeah.
I was like, no way, it's that.
It's called that because it looks like you got slapped on both cheeks.
Slapped. Dude,
like,
oh my god.
It's that bro, like rash.
I could have gotten that in like 2. I was laughing at it, man. Oh
yeah, this
god.
one's pretty common, but it is pretty dangerous for women who are also pregnant too. Because the parvo will basically cause like bone marrow failure. So they'll have like hydrops fetalis where the baby will die in the womb.
Oh my god.
There is another kind of rash besides the slapped cheek rash. There's like the what did you say when you saw scarlet fever? Like, why'd you pick that one?
Well, it's only because it said or scarlet fever.
Oh, okay. There's some like erythematous rash. What is erythema multiforme? Is that what it is?
I just can't get over the fact that like I was laughing at that and I was like, I'm not gonna choose that.
Oh wait, no. Erythema multiforme is something different. Anyway, scarlet fever. So parvovirus is obviously a virus. Scarlet fever is caused by group A strep. And this is like the big like strep infection that causes like the rashes, the eye problems. And that's just from like the toxin in the strep that creates like a big inflammatory hypersensitivity reaction. And that's how you end up with like rheumatic heart disease like later and stuff. Erythema infectiosum. There we go. Okay. Erythema infectiosum. That is 5th disease. Jesus, there's like another name for it. I just call it slapped cheek rash. I don't remember like what the actual name is. Man, PED sucks.
Dude.
But yeah, like the first one, it could have literally been anything. And then it said like strep, or it said like new rash on the face. And I was like, okay. You wanna keep going? Does this count as the finishing the one?
I thought it was. I thought you were gonna do the other one.
Oh shit. Okay, fine.
Good, I know, I feel.
58-year-old man presents with vague epigastric discomfort that has gradually worsened over several months. Vague epigastric discomfort. So,
Stomach ulcer.
yeah, I mean, like, he's got pain in his stomach. It got worse over months. He's probably losing weight because he's not eating as much. We could think, like, depending on his history, like maybe like chronic pancreatitis, pancreatic cancer, a couple of other things. I don't know. If you want to put like do chronic gastritis.
Chronic atrophic gastritis?
Is there any other ones? Yeah, fine. Chronic atrophic gastritis.
What the hell? Dang.
Yay! We did it, Chad!
We did it. Guys, I'm a doctor now. I just took the MCAT.
Yeah, I mean it's really just what it says. It's just inflammation of the stomach, so you lose like the stomach lining. You lose like the rugae, which are those gastric folds, so your stomach is just not going to function as it should.
Yeah.
Yeah. None of these hints said anything about ulcers, so it's basically just like your stomach kind of burns itself out. I think there's some things, like the way I was taught, it was like you get chronic gastritis in like an Asian population or something. Let me see if that's true. Because it's like they say that because of like smoked foods or something. Yeah, it's more prevalent in East Asian populations than Western populations.
Oh.
They still teach these random things. Okay, yeah, East Asian heritage.
Oh wait, the MCAT is to get into medical school? Fuck. Oh shit.
What?
What test did I take then? I thought MCAT was testing out of medical school.
No, the MCAT is the medical college admissions test. So you take the MCAT in college to get into med school. Then you take step 1 after your second year, and you take step 2 after your third year.
Yes.
And then you take step 3 during your intern year of residency.
Yes.
And technically, in some states, you can practice after you pass step 3. If you pass step 3, you can get like a very basic license. But if you don't complete residency, you can't like actually get a job. Like you can probably practice in like Montana or Iowa in like a very rural, like underserved clinic, but you wouldn't be able to work in like a real hospital or something.
Dang.
All right, well, I did my one. Your turn.
What? 2-month-old infant is brought to clinic for frequent crying spells that are difficult to control.
All right, you're another mom.
Foot in mouth.
What?
Foot in mouth disease.
It's hand, foot, mouth disease.
Oh. What? I thought it was foot and mouth. Okay. Infant causes for infant crying. Infant frequent crying spells that are hard to console. Ooh, colic.
Literally anything. That could be colic.
Colic is, yeah. I think I was colic. I feel like colic is the only thing here. Or an ear infection, I feel like, is another one.
Is colic a diagnosis? Ooh, I don't know, actually.
It's not? Colic.
Nah, they give you biliary colic. It's different.
Oh. Okay.
Oh no, he's 2 months old. He's gonna cry.
Yeah, stop freaking crying, man.
This is why I can't be a pediatrician.
Stop freaking crying.
I don't know.
Why is my baby crying so much? Purple crying?
Purple crying?
What is that? Okay, hold on.
Could be sensitive to the
Excessive
formula. Ear
Yeah, 'cause
infection.
they really do anything.
Have
I
you
said
tried
ear infection at
returning the
first.
baby?
Okay. Okay, I don't want the abstract. I want the answer.
You're not gonna find the answer to a Doctordle question by reading a PubMed paper. Frequent crying spells that are difficult to console. I don't know. So I feel like ear infection is totally fine. I don't think it's
That's
right,
right?
but you know,
Oh, okay.
why not? Purple crying.
Huh.
Huh.
Oh, it's just because it's purple is
Green
just an
crying.
acronym.
Oh, what is the acronym? I can't read it.
PURPLE. P,
Okay, what
peak
is-
of crying. U, unexpected. R, resist soothing. P,
Oh.
pain-like face. L, long lasted. E, evening. No way that's one. Purple. No.
Yeah, I thought the baby would turn purple, like a
That's what I was thinking.
cyanotic,
I was
like a
like, yo, give
cyanotic
him air.
disease. Yeah, no, because
Yeah.
there are some like congenital heart conditions where like they get reversal of flow or like they have less oxygen in their blood than normal.
Would teething be a thing? No.
Just put down otitis media. That's ear infection.
Otitis.
Oh yeah.
Yeah. Damn. Rapid breathing and sweating? Oh my god.
Oh wait. I think this is I think this is this. Actually, purple was kind of a hint there.
It has to be something with the respiratory then.
Yeah. Yeah, you could say that. Yeah.
RSV? No.
No, it's a virus.
Is an RSV virus?
Yeah. I'm saying that's a virus. This thing isn't a virus. Or what? Like
Cyanosis? Oh, that's warning signs. Never mind. I do know what cyanosis is, though. When they turn blue. Good.
Saiken would love the NICU.
Pause.
The guy who goes, "Oh no, not peds" on every Doctordle would love the NICU. I had a very good NICU rotation. Our attending was very cool. He was a very old, like, I was surprised he was still practicing kind of guy, but he was a very legit like neonatologist. Like he knew his stuff.
SIDS?
Okay, he's not dying. He's just crying.
You don't know that?
Yeah, and then the fifth one is gonna be like the child dies because you took too long.
Wait,
Rapid breathing and sweating is a pretty big red flag for this one.
and rapid breathing. Well, it's definitely something respiratory. Children's Hospital of Philadelphia? Okay, I guess. I've never been to Philadelphia before. Congenital heart defects? Not that again.
Getting warmer.
Really? It's a heart defect?
Mm-hmm.
Really? This one says ventricular septal defect or patent ductus arteriosus.
Mm-hmm. So a ventricular septal defect is when, you know, you have two ventricles in the heart, right? Your right ventricle pumps into your pulmonary artery that gets, you know, blood oxygenated through your lungs system. Then your left ventricle pumps blood into the aorta, which is where the rest of the blood goes through your body. In a ventricular septal defect, those two ventricles are not completely separated, which means that you have fully oxygenated blood shooting into the pulmonary artery and unnecessarily getting reoxygenated again. And you also have not fully oxygenated blood from the right ventricle shooting through the aorta. So these things are now mixing. And when they're mixing, you're not getting full oxygen delivery as you should be.
Okay, well, it's.
You
it
are
says-
technically correct with that. Roger
This-
Van Bommel says you are technically correct with the VSD, but it is not like the full thing. This one had a movie on it featuring Mos Def, really?
Tetralogy of Valet?
Oh, I guess it is. Wait, I feel like I've seen this movie on like TikTok and stuff. I've seen like clips of it.
Let's go!
Yeah. So it's Philo because he's French, I guess, but it's a tetralogy because there are 4 individual conditions that like cause, or they're all related eventually. So it's like you have an overriding aorta that's like way too big, and you have like pulmonary artery stenosis. So your pulmonary artery is more narrow than normal, and your aorta is larger than normal.
It's a boot-shaped heart.
And then because your pulmonary artery is more narrow, your right ventricle has to get bigger in order to pump out the same amount of blood through that. So the right ventricular hypertrophy leads to that appearance, and they'll also have a VSD with it. So those 4 things make the tetralogy. So when he's having those like crying spells, those are called tet spells. And babies are like smart enough to kind of know what reflexes to do in order to alleviate their symptoms. So like these knee to chest positions and these like different compensatory mechanisms that they come up with kind of correct for the shunting that they're getting. But yeah, you just need surgical repair. Like no amount of medicine is gonna fix this. I think maybe like if they're relying on a patent ductus arteriosus, you can give them prostaglandins. But yeah, you just have to close the defect, and you have to, fix the pulmonary artery and stuff.
Yeah. Dang. And it says reveals a VSD.
Oh yeah, because a VSD is part of it. Like you were getting there. Yeah, it's all of them. So it reveals a VSD, RVOT, overriding aorta, and RVH. That's exactly
Wow. You know what? I think we're gonna be a doctor, guys. Who wants to be my first patient? How about you, Dr. Saiken MD?
You want to be a pediatrician? We can start there. Chat says you are such a good doctor.
Oh my god, really? Thank you. That'll be $5,000. I used to actually want to be, I think I've told my chat before, I used to want to be a pediatric nurse when I was younger, but then I couldn't bear watching children like die and be sick. Like I think I'd literally become a jaded mess that could never have children because I'd be so scarred and so traumatized by watching all these kids die every day. Yeah. That's why I couldn't do it anymore.
Yeah, I made it through a 6-week pediatrics rotation without a single patient dying.
Oh,
that was good. Yeah, I feel like if I was a 3rd-year med student on a peds rotation and like one of my patients died like in the NICU or in the ward, like that would have fucked me up.
Yeah, I don't think I could do that.
Like the kids we saw were pretty sick, but they were like stable sick, like not like they weren't crashing into like PICU at any time, but yeah.
Yeah. No, I think that's what like traumatized me. I was like, I can't do that. I think I would just like cry every day. Like adults. But kids.
Yeah, right. I mean, like you're 80 years old, you smoked your whole life, you've got a terrible lung cancer. Like, I mean, it's sad that you're dying, but like I can understand why it's happening, right? But then it's like if it's like a 2-year-old or like a 2-week-old.
Yeah.
Yeah, like if any of my NICU patients like died, like damn. That would have been really sad.
Also, like you carry a child for 9 months and it dies in like 2 weeks.
Yeah.
Dude, I could not do that.
Damn.
Like when you take home a goldfish and it dies the next day.
Are you speaking from personal experience?
Maybe.
Oh.
Or my hamster.
Oh.
Yeah, that my mom faked. Or she literally did the cartoonish thing of swapping it out thinking I wouldn't notice, and I didn't notice for like 20 years until she told me.
You told me this story before.
Yeah. It's on a short. Well.
All right. It's almost 2 a.m. for me. You wanna you wanna do one more? You wanna close this out?
Was this not closing it out enough?
Oh, okay.
Why don't we work together on the next one?
Okay. Well,
Okay.
You're consulting Dr. Saiken from internal medicine?
I am.
Okay.
Hello, doctor. I am a
hello,
30-year-old
doctor.
man.
Oh, you're role playing. We're not working on it together.
Sorry. Hello, doctor. We're doing rounds right now. Hello, doctor. I'm your. Oh wait, yes. Okay, we're role playing right now. I am your newest intern, and I am here to learn from you.
Okay.
Hello, doctor. This is a 35-year-old man that presents with a progressive dyspnea.
An intern that can't pronounce dyspnea.
Wait, is that how you say it?
Dyspnea.
I said that.
Yeah. Well, I mean,
Okay,
you
dyspnea,
paused for like 2
non-productive
seconds.
cough, and fever.
Okay.
How would you diagnose?
Okay. For a non-productive cough, what am I concerned more than for a productive cough?
You would be more concerned.
Or what am I
That they're-
concerned for more in a productive cough than a non-productive cough? Why do we get productive coughs?
Phlegm?
Phlegm? Yeah, right. So non-productive cough is like this kind of dry cough. Maybe you got like some
Yeah.
spit and stuff. Productive
Yeah.
cough is when you're actually like hawking up like green,
loogies.
brown,
Yeah.
phlegmy.
Yeah.
Usually you're worried about like a consolidation,
Yes.
which is like a lobar pneumonia where you actually not just the pneumonia, but you actually have a specific, bacteria causing an infection
Bronchitis.
in one lobe.
Yes, I
Yeah,
know
you
that
could
because I am
get
an intern.
inflammation. You could get bronchitis too. Yeah, I mean progressive dyspnea, non-productive cough and fever. Like I don't know, COVID. You could. This could be anything.
Whoa. Well, what would you suggest, doctor?
Do they have COVID? Do they have
Should
COVID
I-
at this hospital, doctor?
Let's see. They do not have COVID at this hospital, doctor. The patient cannot have COVID. Or maybe if I put coronavirus. Oh, it is there.
Common cold coronavirus. Common cold. Yeah, fuck it. Whatever. Fine.
No,
Oh.
that is incorrect, sir. It seems that the patient actually presents with, or the patient's chest X-ray reveals diffuse bilateral ground glass opacities.
Okay, it's PJP pneumonia.
Oh,
This is like one of those pathognomonic findings. Yeah, it's pneumocystis jirovecii pneumonia.
Oh, this one.
Yeah,
You said PJP. It's PCP.
they changed the name to pneumocystis carinii pneumonia.
Okay,
whatever.
doctor. Let's see. Wow, doctor.
Wow.
You're so smart. That's
Yeah.
why I'm your intern, and I have to listen to everything that you say.
So this is like one of those AIDS defining illnesses, and it also like he's got a history of IV drug use, multiple
Do you have
episodes of
AIDS?
homelessness. Labs are remarkable for pancytopenia and a CD4 count of 50. So CD4 count is
Wow,
like
that's a lot.
no, that's not a lot.
Wow, that's not a lot at all, doctor. That's not a lot at all, doctor. What are we gonna do?
Yeah, so there are like different opportunistic infections that only happen if somebody's CD4 count is low. So there's Cryptococcus, Toxoplasma, PJP. Like these things only happen when you have AIDS, and depending on how advanced like your AIDS is, then you're going to have these different ones. So you can rule in and rule out certain ones based on what their CD4 count is.
Sir, I think he might have AIDS.
Probably.
Sir, doctor, how would you treat this patient?
It says it right there. TMP, SMX, and steroids.
How do I cover this? Doctor, how would you treat this patient?
Well, I could give pentazimine, or oh shit, what is the P one called? Pentazidine? Pentazidine?
Doctor, you need to know this right now. Doctor.
Pentamidine.
Doctor, I'm your
Pentamidine.
intern. I will fail all of my residency if you do not tell me this answer right now.
Okay, the correct answer is TMP, SMX, but you can also give pentamidine, but it's usually going to be TMP, SMX.
Thank
So
you, doctor. You just saved this man's life.
sulfamethoxazole. That's we just call it TMP, SMX.
If he has AIDS, then he's gonna die. Doctor.
Well, okay, so after, like, let's say labs are remarkable for a CD4 count of 50. So let's assume that the patient like doesn't know, right? So he has a history of IV drug use, right? Maybe he contracted HIV a while ago from like sharing needles or something.
Oh my god.
And then they get sick enough,
Fenty folding,
and then come into the hospital, and they get, you know, diagnosed with AIDS based off of that. So
Fenty folding.
we have like combined highly active antiretroviral therapy that we can start. We don't start it in the hospital because of immune reconstitution inflammation syndrome, IRIS. But we would treat the pneumonia, the PCP pneumonia first, and then we would refer them to, you know, the HIV clinic or something, and we would start medicines like Biktarvy or, you know, Emtreva or whatever. Nowadays, we actually do have very potent, like, combined anti-HIV drugs now. So, yeah, it's not like a complete death sentence like it was in the 90s. If you've, you know, like Rent, right? Or Angels in America.
Rent.
Yeah, like back in the 30 years ago, like this was completely unknown. People were dying from, you know, HIV AIDS by like the thousands. But I think, you know, by the 2010s, I think we figured it out pretty well. And we get these patients plugged in with the care that they need.
Your chat said he didn't do fent, he did heroin. Everyone knows this. No, I don't, because I am clean. I do not know
HIV
what
can be
drugs are.
functionally cured. Functionally, yeah. So non-detectable means non-transmissible, which is a huge thing too, because when your patients, you know, are plugged in with the clinic and they're on the medications that they're supposed to be on, not having a detectable viral load also means that they cannot transmit a viral load to somebody else. So the more people that we get on these antiretroviral medications early enough before they, you know, their CD4 count completely crashes and their viral load becomes too hard to handle, like we can really help them out early enough. And then, yeah, you actually see a lot of patients pop into the HIV clinic after the hospitalization too. And this is usually like what the infectious disease doctors, I think, like when I was in residency, all 3 of our infectious disease doctors that took call at the hospital also worked in like the HIV clinic as like their day job too.
Wow, I'm learning so much. Thank you, doctor.
Yeah.
I will now proceed to do all of the paperwork for you while you get to sit back in your doctor's lounge and I go into the really crappy resident room and eat my crackers and honey.
Oh my god, music to my ears. Get some peanut butter crackers, some saltines.
Yep.
A ginger ale.
I'll do all of that for you, doctor, and do all of your paperwork for you.
Good.
Oh.
I deserve it.
Yes, sir. Yes, you do.
All right. You wanna say goodbye to everybody?
Sure. Thank you, guys. My name is Hazumi, MD. For today, I am your intern doctor here at the Saiken MD clinic, and thank you for having me. I hope I did better than Bree. Question for chat: of the 2 doctors, who would you choose to have you be your diagnostic doctor during rounds and inpatient? No, no, you can't. No, Saiken is not an answer. It is me or no, it's me or Bree. It's me or Bree. Which of the interns would you choose?
God, if Bree was my intern.
No, you can't. You cannot say Saiken. You cannot say Saiken. Stop. Oh yes. Okay. I'm seeing the right answer.
Hazumi, obviously. Hazumi. I choose death.
Excuse me. Lest you forget, I got 1 answer correct in the first try.
That's true. You did get 1 in 1. I don't remember what it was, but you got 1 in 1.
The very first one.
Was it the abnormal uterine bleeding one?
Yes, it was.
Yeah, nice.
Probably because I'm a woman with a
Hazumi MD. Hazumi MD.
Yay! Thank you. I'm so happy to be an intern. You've inspired me. I think I'm gonna go become a doctor.
You couldn't even say that with a straight face. You're like, I'm gonna go become a doctor.
Don't worry, chat. I'll get better. Oh my god, actually, that'd be so cool if I had some sort of like growth, like character arc, and you bring us back, and we see if we get better.
Like, I bring you back in like 6 months and you're a PGY2?
Yeah, or like a, well, no, why would I be a, oh, because I'm an intern, yes.
You don't even know your own lore.
No, it's because I was thinking in real life. I was like, how would I be a PGY2 in 6 months?
What do you mean? It's May. Your PGY2 year starts in July.
No, I meant, I forgot we were role-playing that I was an intern. I meant in real life, starting from literally nothing.
So you want me to call you back in like 7 years when you're a PGY2?
Yes.
Oh my god. Yeah, and then Bree will also be a PGY2, right?
No. Yes. I'm gonna go into the medical field now, saiken MD. Thank you.
Are we still role playing?
We'll never know. I guess we'll never know.
Okay, bye.
Oh, okay. Bye.
Okay. Thanks guys for stopping by. I'm sorry the power went out and it got super scuffed. Honestly, like I said earlier, like I think it would have made a lot more sense if we had Hazumi on first and then we did this with Bree, but I had fun, right? I tried to explain a lot of different things. So again, I still think you're the correct choice because the interns would be in the paperwork dungeon. AMCAS just opened. Oh, time to apply. Actually, isn't ERAS also due soon for anybody up in med school applying to residency right now? Bring her back in 7 years. Yeah, do the exclamation point remind me. Check up on Hazumi if she's in med school. No, ERAS is in September. ERAS doesn't open until September. Oh, but Bride just messaged me and he said, oh, whatever. Anyway, it's nice to practice too. I feel like Doctordle is just one of those things where I could just go on and on about it. I mean, I can do another stream and just play Doctordle if you want me to, but I wanted to get some different perspectives, you know, keep it fresh. It's no big deal, it's fun, even with the power outage. Yeah, no, I'm so impressed that like 80 of you on Twitch and 130 of you on YouTube still stuck by here. Like I did not expect you guys to stay. But thank you. How do you feel about AI in healthcare? I mean, so specifically me as an inpatient hospitalist, like we use ambient scribing, we use like AI note summaries for like hospitalization courses or previous medical history, like previous hospitalizations. It definitely has a place. I have not necessarily relied on AI for like clinical decision support at this time, but if you know anything about, you know, how AI and companies like butter up to each other, like, you know, corporations like regulate their employees to use their AI and they like monitor their credits and their usage. And I feel like it's going to happen sometime soon. But as of right now, I still mostly use it as like a summary tool. I have not been forced to implement it anyways. So I can write my LOR. All right, come to my hospital. I work with the residents and med students here. So what if those summaries hallucinate info? Yeah, exactly. So you always gotta cross-check it, right? You can't just press generate and then copy and paste it, right? You gotta make sure that everything lines up with what's documented. So I'm using open evidence only. It has good and bad qualities. Open evidence is pretty good. Obviously it's probably the most popular one right now. As like a simple one click, if I need an explanation on something, I still feel like I would rather look it up in UpToDate, or if I would rather go for like, I don't know, when I was in residency, I would look something up in like Pathway, or I would look something up in Mixapp before I would just ask open evidence. But I feel like open evidence, if you want to ask a clinical question about like a specific study or something, I feel like it's fine. WebMD symptom check. Yeah, I would not expect a WebMD symptom checker to be up to bar. Yeah. I know you don't work in EM, but what do you think about The Pit? Have you watched it? I watched like the first 5 episodes of season 1 or something. I mean, like, I think in like the next video, I think in the video I'm about to release tomorrow, I talk a little bit about The Pit. But I mean, it's interesting. It's just super fucking exhausting to watch. right? Like, as somebody who already does inpatient medicine all day, like, I don't want to come home and just watch people do emergency medicine. Like, what? Like, I like House. I like Scrubs. Like, I like stupid shows about like vibes and like dumb characters. Like, The Pit is just like I think I liken The Pit to like chefs watching The Bear. Like, it's just stressful, right? Like, why would you come home from a 12-hour shift just to watch people on a 12-hour shift? And I was like, ugh. All right, guys. I am going to be ending stream. I still have not really figured out the YouTube rating system. So I'm just going to end stream normally. I feel it's like you have to like find a link beforehand to figure out where to raid into, right? Like I never figured that out. 8 years, by the way. It's my second stream on YouTube. If this Twitch, of course I know how to raid on Twitch. Dude, back in my day, we had hosting. We had all these things. But like YouTube, it's like you gotta find like the stream that you want to raid into, or you want to like the video that you want to redirect to. They're not even called raids, they're called redirects. I know that. But yeah, I'm still figuring it out. I've talked to a couple friends. I've talked to a couple friends of mine who made the switch from Twitch to YouTube, like full-time streaming. And I do want to get more comfortable streaming on YouTube. Obviously, I have more viewers on YouTube at this point. And once that, health partner verification goes through, I think it's just a lot more convenient to have all of my streaming and my videos done on YouTube. YouTube hurts us. I'm sorry, Zayu. Twitch won't verify my medical license. Hey, if Dan Clancy wants to verify my medical license and display it on my Twitch channel, that would be pretty great. Unfortunately. Come back to Fire Emblem. It's 2 in the morning. I'm gonna come to bed. You can get partnered. Yeah, I know I can, but so the only reason I am streaming on YouTube right now and multi-streaming is because like they have this program which verifies my medical license. And I think having that alongside all of the videos that I push out, it legitimizes my content, right? Like, I'm not just some random guy talking out of my ass or like regurgitating stuff that I found on, like ChatGPT or Claude or whatever. Like, I am a licensed medical professional in the United States giving, medical information from a responsible source. And YouTube is the only platform that has a system where I can do that, right? Otherwise, I would have to be like most other physician content creators, and you guys wouldn't know who I am unless I show my face and show you guys my name. And ultimately, that also shows you like where I work at, where I live. And as a VTuber, I feel like that's kind of weird. So yeah, please don't stop streaming on YouTube. Yeah, no, the grand scheme of things is I will eventually phase out of streaming on Twitch and start streaming on YouTube only. But, as of right now, we're going to keep multi-streaming. I will still continue to stream once a week, as I always have for the past 8 years. But eventually, things are just going to move onto YouTube. YouTube is cozier than Twitch. Cozier for the viewers, maybe. I still can't figure out why I have to click go live after click like streaming. But yeah. There's also dangerous revealing personally identifying info. I remember the rules of our generation, saiken, for the millennials and very early Gen Z. Yeah, exactly. YouTube hates creators. Like, I'm not saying I'm doing YouTube as a creator, right? I'm doing YouTube as a physician. Again, if Twitch had the same medical licensing thing where it verified my activity and everything, like I would stay on Twitch the whole time. But it's just they're not gonna verify me like that. Twitter won't verify me like that. Remember, like back in the day, you used to be able to get like a special check mark to show that you're a medical professional in like the fight against medical misinformation. But when it changed into X and you could pay for your check mark, they took that system away. So yeah. Some people have been fired for being a professional influencer too. The VTuber identity is a good idea. I think it's just like the kind of person that I am and the stuff that I do. Like I could very easily create all of this content with my face, right? I started streaming with a webcam for like the first 6 years of this whole thing. It's just now that like I'm like a working professional, like I don't want to be recognized with my face first, right? I don't mind, like, if it comes out who I am, it's fine, it's whatever. But I like being a VTuber, right? I like our little corner of the streaming world and the internet and the little kind of culture that we have. Like, I want to keep being a VTuber as long as I can. So the biggest thing is that, yeah, YouTube platform is better for professionals. It's the professional thing, right? I just want to be able to tell people, like, hey, I'm not making this shit up. Like, this is actually trustworthy information, and YouTube is the only one that can do that. So yeah, Twitter is really horrible right now. I mean, it's always been terrible, but it's worse now. Well, whatever your feelings on Twitter are, it's still like the central activity for English speaking VTubers. Oh well, it is what it is. Anyway, I'm at least being able to have the banner and just be like, hey, then I feel like is just a lot better. Did my stream stop again? Hello? Oh, it dropped and then, all right. Clearly something is still fucky with the internet. Anyway, I was just saying that, like, it's not something that a majority of people think, but I think whenever I get negative comments or I just get anti'd by, you know, people on social media, they just go like, oh, well, you're not a real doctor, or you're just a VTuber pretending to be a doctor. And so at least if I have like verification on one platform, at least I could just point it to that and be like, no, I'm actually verified. Like, this is my license. I know what I'm talking about. A bit lagging. Yeah, it's time to go. It's time to go. Okay. Thanks, everybody. All right, I will try to stream again next week. I might be busy on the weekend, so if not, then definitely the week after. But we're chilling. I'm not super busy. I just got some projects to do. Audio dropped. Oh well. Let's get out of here. Clearly something is broken. All right. For everyone, have a good day, night, wherever you are. Hydrate. Take your medicines. Stay healthy. Bye.